Good morning to our participants and attendees in the US, and good evening to all our participants and attendees in India. My name is Jagdeep Ahluwalia. I am the founding secretary of the 21-year-old Indo-American Chamber of Commerce of Greater Houston, which I currently serve as executive director. Houston is home to the Texas Medical Center, the largest medical city in the world, at the forefront of advancing life sciences, with over 10 million patient encounters per year, 106,000 plus total employees, and it is the eighth largest business district in the USA. Houston is also home to the Consulate General of India in Houston, the host of today's event, which is led by a very able and distinguished Consul General, Aseem Mahajan. On behalf of the Indo-American Chamber of Commerce of Greater Houston, we want to thank Consul General Mahajan for hosting today's program, and we want to thank our sister chambers for supporting the event. These include Invest India, the USIBC, the Greater Houston Partnership, the US-India Chamber of Commerce, Dallas-Fort Worth, the Confederation of Indian Industries, FICCI, and ISCC, the Indo-American Chambers in India. I would like to now introduce the Consul General of India in Houston, who, in spite of the coronavirus throwing a curveball, he has done a phenomenal job developing relationships, engaging with the diaspora, as well as key partners, and providing much needed consular services. Ladies and gentlemen, it is my honor and privilege to invite the Consul General of India in Houston, Aseem Mahajan, to make his welcome remarks. Thank you.
It gives me great pleasure to welcome all of you today for this webinar on India-US partnership in healthcare and medical research. India and United States share close multifaceted ties. Economic and trade ties are an important component of our relations. The healthcare sector is predicted to grow steadily in both India and United States. Given the complementarities, companies in both countries have a great opportunity to build synergies, including to partner together for global supply chains, joint research, and manufacturing. During the current pandemic also, India and US institutions and companies are jointly engaged in several areas of healthcare. The Indian Council of Medical Research is also closely working with the Center for Disease Control and Prevention and National Institute of Health of United States. This part of United States is home to many globally acclaimed medical research institutions, universities, large US corporations, and companies engaged in healthcare. The Texas Medical Center is one of the largest medical complexes in the world. We have several ongoing initiatives between institutions like the MD Anderson Cancer Center, Baylor College of Medicine, University of Texas A&M Medical School, University of Houston, and other institutions in areas like clinical exchange programs, research collaborations, hospital management systems, and sharing of knowledge and technologies. The program today includes an interactive session and presentations, including by our Secretary Pharmaceuticals, who will give an overview of the healthcare system in India and the productivity-linked incentive scheme. States of Andhra Pradesh, Gujarat, and Himachal Pradesh from India will highlight the investment opportunities there. Dr. Peter Hotez, a renowned expert on tropical diseases and vaccines, Greater Houston Partnership, Texas Medical Center, will also make presentations, and Indian and US companies will share experiences. All this is aimed to highlight the immense potential in this area. We hope today's event will be a valuable resource of information for the dialogue on India-US partnership in healthcare and medical research, which we plan to continue with subsequent events focusing on verticals, including collaboration between medical institutions, hospital management systems, manufacturing of medical devices, drugs and formulations, and robotics, automation, and digital health initiatives. We will continue to look forward to your support for this, and we will be sharing these resources which are there available with us today and have an opportunity for people to give us a feedback. And we also hope to act as a bridge for you to build and strengthen our partnership. I now invite our Ambassador to United States, Mr. Taranjeet Singh Sandhu, to deliver his address. Ambassador Sandhu is amongst India's most acclaimed and experienced diplomats, with wide-ranging experience on India-United States relations, having served earlier twice in Washington and also in New York. Prior to his assignment, Ambassador was India's High Commissioner to Sri Lanka. He has also held many other key positions, both in the Ministry of External Affairs and India's missions abroad. Over to you, sir.
Thank you, Consul General Mahajan, Secretary Vaghela, Dr. Hotez, Vice President Davenport, Invest India CEO Deepak Bagla, very senior officials of Andhra Pradesh, Gujarat, and Himachal, as well as other officials of Government of India, distinguished leaders of pharma and health industry from the United States and India. It's a great pleasure to be able to join you all virtually, especially to discuss one of the most critical sectors of bilateral cooperation. My compliments to all the organizers. The global health emergency has made it clear that ensuring equitable, affordable, and timely access to healthcare products and technologies is a priority for all. The global pharma and healthcare industry bear an outsized responsibility in meeting the current challenge. During my interactions with the policymakers and industry leaders over the last few months, I have highlighted the tremendous scope of bilateral cooperation in the area of healthcare and medical research. We need to tap and build on the synergies that exist in this sector between our two countries. The United States is a global leader in pharmaceutical research and development. India has a large pool of scientists and researchers. In fact, over decades, many Indian doctors, scientists, and researchers have come to the United States and distinguished themselves. There is much that India can learn from the US to develop its own pharma innovation ecosystem. India has a long-standing partnership with the US in the area of health and scientific research. We have closely collaborated in combating diseases such as tuberculosis, cancer, HIV, and eye-related. Under the India-US Vaccine Action Program, NIH and India's Department of Biotechnology and ICMR are closely collaborating. Since the initial days of the outbreak of COVID, our scientists and institutions have been actively engaged in exchange of information. COVID-19 virtual networks being developed under the India-US Science and Technology Endowment Fund will allow Indian and US scientists and engineers to carry out joint research activities virtually and leverage current infrastructure and funding mechanism. Indian pharma industry companies, which are world leaders in affordable, low-cost medicines and vaccines, are collaborating with the US companies in vaccine development, therapeutics, and diagnostics. For example, Gilead has entered into licensing agreements with 7 Indian companies to manufacture remdesivir and supply it to more than 127 countries in the world at a very affordable price. Similarly, India has been working with the US private sector in vaccine development. There are at least 3 ongoing collaborations of Indian and US companies and institutions to co-develop and produce a COVID-19 vaccine. The Indian companies, including Serum Institute and Bharat Biotech, have the ability to scale up manufacturing of the vaccine and ensure availability to meet global public health needs. India's healthcare sector has become one of the largest sectors, both in terms of revenue and employment. National Health Protection Scheme, or Ayushman Bharat, the largest public funded healthcare program in the world, is driving healthcare spending. The government aims to increase healthcare spending to 2.5% of the GDP by 2025. India's advantage lies in its vast pool of well-trained medical professionals and its competitiveness. India's healthcare market is estimated to increase by 134 billion US dollars by 2022, while its pharma sector is expected to grow by $100 billion by 2025. India is amongst the top 20 markets for medical devices in the world and is expected to show significant growth in the next 5 years. Government is reforming regulatory processes for this sector and is putting in place measures to correct duty structure. Hospitals and diagnostic centers also offer significant opportunities for investment. We have inherent strengths in pharmaceutical sector, which receives significant foreign investment. India is the largest supplier of generic medicines globally. We occupy 20% share in the global supply by volume and also supply 62% of global demands for vaccine. The cost of manufacturing medicines in India is approximately 33% lower than that of the United States. Cooperation in healthcare, in pharma, basic research, vaccines, diagnostics, devices, telemedicine, hospital administration, healthcare supplies, healthcare expertise is a major opportunity for India and carries great potential for collaboration with the United States. With these words, I look forward to hearing the comments of the other panelists and experts. Thank you very much.
Thank you very much, Ambassador Sandhu. It's an honor and privilege to have you address this August gathering. The Chamber in Houston, along with the Greater Houston Partnership and the Consulate in Houston, have been thriving for the last 20 years to keep building on the bridge between Houston and India. And the partnership is one of our strongest partners in this relationship. In Susan Davenport, who is our next speaker, we have a tremendous ally who recognizes the strategic importance of the Houston-India Economic Partnership. And we have collaborated with the partnership on outbound missions, including the one led by Mayor Sylvester Turner of Houston and several inbound delegations. I now hand over to Susan Davenport, Senior Vice President, Economic Development with the Greater Houston Partnership. Susan, on to you.
Consul General and the Indian Chamber of Commerce here in Greater Houston. We appreciate the invitation and look forward to talking with you further about opportunities for collaboration. We have had a strong relationship and look forward to continuing that as we find additional avenues for collaboration, especially in this medical and healthcare arena. What I'd like to do is briefly begin our conversation this morning with some facts about India and Texas that really pertain to our avenues for collaboration in healthcare. We will pull up about 6 quick slides and I will begin the conversation. Please know that at the end of the presentations this morning, 2 of my international investment and trade team members will be on the panel at the end to answer any questions about ways to access the collaboration that we will discuss. And following my brief slides, we will have an expert, Dr. Emily Riso from the Texas Medical Center, who will talk specifically and in greater depth about the medical center. So if you can turn to the first slide, I would love to begin with some quick opportunities that we will talk about with Texas's capabilities as a world leader in life sciences. There are approximately 5,000 life science firms and manufacturing firms throughout Texas. They employ collectively about 100,000 workers in related fields to these avenues. And we are home in Greater Houston to the world's largest medical center, the Texas Medical Center, which is the home to approximately 55 to 60 institutions and hospitals in this region that are collectively connected in a 2 square mile radius in Greater Houston. There are approximately throughout Texas 27,469 clinical trials underway, which presents Texas as the #2 state in the country for clinical trials, and again allows great opportunities as we collaborate with India and around the world. We have about $5.3 billion in annual research and development expenditures throughout Texas. And finally, 7 of our medical schools are in the nation's top 100 medical schools and are all here in the state of Texas. Next slide, please. Let's drill down a bit into Houston. I would like to, again, as we tee up these conversations, tell you a bit more about the greater Houston region. If you'll turn to the first slide. Houston is known to be it's actually the most diverse city in America. About 25% of our population is foreign born, 1 in 4 Houstonians. We are an incredibly inclusive city, no racial majority here. We have the 5th largest LGBT population. The #1 US city for minority entrepreneurs are here in Greater Houston. And we speak about 145 different languages in this region. Immigrants account for actually 1/3 of the population growth, which, as you may know, between 2000 and 2018, we were the fastest growing metro in the United States with over 18% population growth during those years. Again, the most diverse city in America. Next slide. And our talent base is second to none. We are the home to 40+ colleges and universities, actually 20 two-year institutions of higher education and 24-year institutions of higher education. Collectively, they enroll about 430,000 students. And the great part of that is that we have the 76% retention rate of those students when they graduate from our institutions of higher education here in the greater Houston region. It's the 2nd highest retention rate in the nation. We have 350,000 educated millennials already in our region, and we are the youngest major metro out of the top 10 major metros in the United States, with a median age of about 34.6. Again, the youngest major metro in the country. We have a vast history of innovation. As you know, we are the home of human spaceflight through Johnson Space Center and NASA 51 years ago, putting a first man on the moon. We did the first artificial heart transplant here at the Texas Medical Center, revolutionized the global energy industry. We are the energy capital of the United States with over 4,800 energy establishments here, and now digital technology being infused across the spectrum of those entities. The largest JLabs footprint in the United States. We are a world leader in genomics and pioneering research on cancer treatment especially through the world-renowned MD Anderson Medical Institution here in the Texas Medical Center. And again, you'll hear more about that in a moment. Next slide. We are considered the 3rd coast for life sciences. It is a great opportunity for Greater Houston with these vast assets to move forward in this region. In 2018, we were named the #2 emerging cluster for life sciences in the United States. And in addition, the 3rd fastest growing life science market in the country. We have over 300+ biotech, life sciences, and oncology companies beginning here in the Greater Houston region. And collectively, we've been able to bring in over $540 million in health innovation funding between 2014 and 2018. Next slide, please. And so that you can understand a few of these names, you will see many that you recognize and some that not. But out of those 300, at least 60 of those employ more than 100 people already in Greater Houston. Again, the 3rd coast for life sciences, and an area in which intense funding and opportunity is being directed through our greatest asset, especially the Texas Medical Center. And again, you'll hear from Dr. Reiser momentarily. Jagdeep, I will turn this back. Oh, excuse me. And then again, I will end with our Houston-India commercial ties to highlight that We are the third busiest gateway for US-India trade by value. India is Houston's sixth largest international trade partner, which has been rising dramatically over the last decade. And in 2019, trade between Houston and India was valued at $10.1 billion, a high since 2010. We have 28 Indian firms operating 28 subsidiaries in the Houston area, including Gale, JSW Group, Leal, Neilsoft, and Thermax Limited, and several others. And again, I want to thank you again for being part of this. Thank you for including the Greater Houston Partnership. And we look forward at the end to our International and Trade Team Division having representation on the panel to answer any questions on how you connect through to our region. Thank you, Jagdeep.
Thank you very much, Susan. Our next speaker is from the Texas Medical Center, which has 106,000 plus employees, and it's the 8th largest business district in the USA. And since the early 2000s, the consulate and the chamber have worked very closely with members of the TMC, like MD Anderson, to help build relationships with, for instance, the Tata Cancer Center in Mumbai and S. Vyasa in Bangalore. And thanks to that relationship, yoga is now taught as part of treatment at MD Anderson. It's my honor and privilege to welcome Dr. Emily Reiser, Senior Manager of Innovation, Community Engagement at the Texas Medical Center Innovation Center. On to you, Emily.
Thank you very much, Jagdeep, as well to Susan and to the Consulate General for the great introduction to the amazing power of collaboration that's possible at the Texas Medical Center. So you've already heard about our 10 million patient visits a year and our excellent clinical care. But I'm going to talk to you a little bit more about how we really leverage that incredible power and turn that into great ideas and opportunities for our member institutions, like Baylor College of Medicine and Texas Children's, which you'll hear from shortly as well. So about 6 years ago, the Texas Medical Center came together with the CEOs of several of these large institutions and asked, what can we do better to support collaboration among each of these institutions? From that meeting, the TMC Innovation Group was born, and we're dedicated to helping each of our member institutions really leverage innovation in a great new way. To that end, we've created an incubation space, a collaboration space. We've really captured the density of corporate partnerships and seek to support our member institutions each and every day. One of the ways that we do that is through our TeamCX Accelerator program. And that's the way that we see most of our international partnerships to be formed. We scout around the world for technologies that are aligned with strategic focus areas of our hospitals, particularly in digital health and medical devices. Although through our partnership with JLabs and other local lab spaces, we do have pharmaceutical relationships as well. But focusing on digital health, for example, let's say one of our clinical partners is looking for a solution to staffing, and we have relationships around the world with companies and with other partners that have developed solutions for staff management within a large healthcare system. That has been only occurring in that home country. So we meet with that founding team and we assess whether that team would like to come to the US and build their first US headquarters here with us in Houston. In order to make sure that they're supported on that journey, our team is dedicated to helping them to build relationships with our clinical partners that are seeking that technology, as well as with strategic mentors, advisors, and investor partners to give them everything else that they need to be successful transitioning their business into the US. The US healthcare system is incredibly dynamic and complex. And so our goal is to help to make sure that the value proposition that a company is bringing from their home country is well aligned and well matched and well suited to be a great company here in the United States. So we've done this successfully over the last 6 years, partnering with companies that are very small, all the way to ones that have over $70 million in funding and 80 employees. But really, as long as a company has something of value to bring to our member institutions or corporate partners, we are the team that's going to help wrap around all the things that you need to be successful in that journey. So I'll leave it there for now. I'm delighted to speak with everyone in the Q&A or after the session if you have any further questions. And it's been my pleasure to speak with you so far. Thank you, Jagdeep.
Thank you very much. Whenever we have an inbound delegation, we try to take them to see the innovation that TMC offers. It's also one of the most important outcomes of research from the medical center. Now to take it to a more international level, we are lucky to have Dr. Hotez in Houston, who is an internationally known figure. And we are deeply honored that he makes the time for us to join us, be it a chamber outreach effort or for today's session. Having his voice and thoughts on today's deliberation is critical as he plays a leading role nationally and globally in helping humanity overcome the coronavirus. Dr. Peter Hotez is the Dean of the National School of Tropical Medicine and a professor of pediatrics and molecular virology and microbiology at the Baylor College of Medicine. My honor and privilege to welcome Dr. Hotez to make his remarks.
Thank you very much, Your Excellency. I really appreciate the opportunity to make a few brief remarks today. Tragically, both the United States and India share a terrible situation right now with COVID-19. In India, the number of cases is rising dramatically. There's right now 2.2 million cases estimated in India, and we're seeing a steep acceleration across the country, especially in Andhra Pradesh and Maharashtra state and a few others. And so we're very concerned. And we also, of course, have a terrible problem with COVID-19, especially in Texas. Although it's now plateaued, it's plateaued at what I like to say 100 miles an hour. It's plateaued at a very high level. And what we're doing right now is India and the United States are working together to solve this problem. You heard about the joint vaccine development efforts with the Serum Institute of India, and we know them very well, an outstanding organization, as well as Bharat, another great Indian vaccine manufacturing organization. You know, India has always had excellence over the last 20 years in innovation and vaccine development. And now we are hopefully announcing soon a partnership with the third vaccine organization in India. I was hoping to be able to announce it today, but we don't quite have all the press releases together, but hopefully very soon, with the idea to develop a low-cost vaccine, because one of the big problems that we face right now is the current vaccines being manufactured through Operation Warp Speed in the US are extremely expensive, number one, and number two, they're only guaranteeing that 20% of low and middle income countries will have access to these vaccines. So we're hoping to buck that trend and make available widely a low-cost vaccine. So I'll just give a very few brief remarks by PowerPoint presentation here. I don't know if you're going to change the slides or if you'd like me to do it.
So the consulate will change the slides.
What's that?
The consulate will change the slides. You just
okay, fantastic. Yeah, we'll just do this very quickly. This is a new book which you can download free of charge through Johns Hopkins Project Muse, called Poverty and the Impact of COVID-19, and makes the very interesting observation that COVID-19, like many other poverty-related diseases, have a surprising frequency in the group of 20 countries. So it's the poor living among the wealthy that now account for most of the world's poverty-related diseases, including COVID-19, where you can see that almost all of the 20 million global cases now are currently in the G20 countries. But the piece that not many people articulate is that it's the poor living among the wealthy that account for these illnesses. And this is true in the United States, where it's very much a health disparity. It's true in Brazil, Russia, India, South Africa, Mexico, and Saudi Arabia. Next slide, please. And you can download that book free of charge through Johns Hopkins University Press Project Muse. So in the US, we're accelerating vaccines, and we hope vaccines will be ready by next year. In the meantime, I've now put forward a an October 1 recovery plan where if we can get the leadership of the US on board, we can make a big dent right now, even with existing public health control measures. But it goes to the problem that getting advocacy around public health control is always problematic. And this just came out on the Microbes and Infection website, and you can see it on my Twitter feed as well if you'd like. Next slide, please. So as you can see, there are multiple vaccines being accelerated for COVID-19. One of the observations about all of these vaccines is they all pretty much work in the same way, in the sense that they all induce a strong immune response against the spike protein of the virus. By now, everybody has seen cartoons of the spike protein. That's the part that binds to the host tissues. This is a slide from Anthony Fauci, presented a few weeks ago to the National Academies, showing that there are multiple different ways to generate an immune response through adenovirus vector vaccines. This is what the Serum Institute is working on with Oxford. You have mRNA, DNA vaccines, and our recombinant protein vaccine at Baylor that will announce soon in a partnership with India. Next slide, please. And to do this, we engage not only with India, but also this very interesting organization called PATH. Not many people know about it. They historically have done a lot of work with the Bill and Melinda Gates Foundation to develop the malaria vaccine for Africa, the meningococcal A vaccine, jointly with Serum Institute and Africa. And now we're partnering with them with this new partnership for a low-cost COVID-19 vaccine for the world, which will be scaled up and produced in India. Next slide, please. And this is our Texas Children's Center for Vaccine Development. That's what CVD stands for. Has a longstanding tradition of making global health vaccines low cost, primarily for parasitic diseases. And then about a decade ago, we were approached by a group at the New York Blood Center that had some innovative ideas for making coronavirus vaccines. And we've been making coronavirus vaccines for SARS, for MERS, and now SARS-2. And particularly worried about the problem you see on the lower left. These are the large urban areas, the new mega cities popping up across low and middle income countries, and where you can imagine the problem of doing social distancing is extremely complex, and therefore we think a vaccine is going to be especially important. Next slide, please. So our low-cost vaccine uses a yeast expression system. You might say, well, why do I care if it's made in yeast? The reason it's relevant is that yeast has been used to develop the recombinant hepatitis B vaccine, not only used all over the world, but made all over the world. So Bangladesh makes their own hepatitis B vaccine. So does Brazil and Cuba, India and Indonesia. And because the infrastructure is already there for producing it, we think we can slip right in and accelerate technology transfer. And this is, in fact, what we're doing. I'll finish up here with our last slide. Just to say we are also battling a pretty strong anti-vaccine movement in the US. And this is another aspect that we can talk about, which unfortunately has become globalized. Maybe at the Q&A, we can address that. So I'll stop there. Thank you again. And it's been really exciting to do this partnership for India. Thank you.
Thank you very much, Dr. Hotez. We are really grateful to you for making the time. He is an internationally known figure. And today's event is an international event because the jurisdiction of the consulate in Houston covers several surrounding states. The ambassador's jurisdiction is all over America. And we are privileged to have a very important official from India on today's call. The eyes of the world are on the Indian pharmaceutical industry. And as we look for cures for COVID-19 and many other medical conditions, we are privileged to have with us today Dr. P.D. Vaghela, the Secretary, Department of Pharmaceuticals in India. I would now like to welcome Dr. Vaghela to please address the group.
Good morning to everyone, and those who are in India, good evening. His Excellency Ambassador of India and Consul General of India, Houston, the distinguished panelists, ex-secretaries from 3 states, Andhra Pradesh, Gujarat, and Himachal Pradesh, which are leading in pharmaceuticals and health sector, and other guests. I should first thank His Excellency Ambassador of India for inviting me to make a small presentation on largely on pharmaceutical sector, and I will be touching health sector also. As you know, and as has been told very rightly, that we all are in very difficult times. We all are fighting COVID-19, and India, our numbers are increasing. Fortunately, we have been able to create infrastructure in form of hospital beds, medicines, doctors, medical equipments, and we have been able to keep our death rate much lower compared to many countries. And I am very happy that USA, in partnership with private sector, is developing vaccines. They have taken 2 projects in India. Also, Gilead, I should thank that Gilead has given licenses to 6 companies. Of that, 4 have already started production, and this remdesivir is being used in India in very large scales. Again, Roche, which is increased their supply of one medicine which is very much required in India, and that is also very useful to us. What I would like to, I will take a small view of the whole health sector. Next. Yeah. So our view, the general vision of the government of India with health is to provide highest possible level of health and well-being for everyone at all ages through preventive and promotive healthcare orientation policies and universal access to good quality health services. And the people should not face any financial hardship. Pharmaceutical sector is playing a very, very important role when it comes to this thing, providing healthcare to each and every citizen of India. So we have concentrated on making this thing investment in pharma sector, in medical devices, and we are now concentrating on R&D, industry expansion and skilling. So and also we have now started a very big project of providing generic medicines to the poor and lower middle class of India, and this has actually saving their health bill by almost 80%. That is what we are providing around 1,200 medicines and surgicals to the poor of India through special stores. Next. Next. Yeah. So I will tell you. So India, in the last 5-6 years, our low expenditure to GDP was only 1.4%, but now this is increasing very fast, and our aim is to increase to 2.5% by 2025. And we have concentrated on the increase of the budget, CSR, and 1% sales on the health. So this way, we aim to increase the spending on health. And another thing which we have done is that that out-of-pocket expenditure is very high. So as I told you, we are providing generic medicines to the poor and the middle class in the country. But however, we also are providing financial protection to entire population. We have Ayushman Bharat scheme, which covers almost 40% of the population of the country. That means almost 500 million. And we have also improved efficiency in health insurance ecosystem. So that is one thing. And then we have started, health and wellness centers all over the country, which provides preventive and promotive healthcare to the patient and free essential diagnostics. And we also have started teleconsultation. Our more thrust now we have given, and USA will be pleased to know that we have critical dependence on APIs on certain countries, and in the difficult times, we have now decided to decrease our and reduce our dependence on APIs and medical devices, some critical medical devices also. So, and this is, in short, I would like to say R&D, because I think USA can play a very big role. We are working on the policy, on national policy of research and development pharmaceutical, and there we will be requiring greater role from the US, especially in education sector. The universities, they can come to India and they can set up their campus and even universities in India in healthcare sector. So there's huge and growing healthcare market, and there is huge opportunity for investment. Next. Next. Yeah. So I will tell the pharmaceutical sector. I will concentrate on that. We are the third largest by volume. But however, we are, when it comes to value, we are 14. That means we are providing very, very cheap medicine to the whole world. So, that value our prices, our medicines are very cheap. And then we manufacture more than 500 APIs. And these APIs, and the formulation minimum APIs, we are providing to the whole world. We have got more than 100 pharmaceutical and medical device clusters with all the forward and backward linkages, and more than 600 sources of generic brands across 60 therapeutic categories India has. That way, India is rightly told pharmacies of the world. And what our strength is that we are the largest supplier of low-cost generics, vaccines, and affordable HIV medicines. We also provide much needed COVID medicines to the world, as well as CQ and many other medicines. We have not allowed scarcity of medicines to arise in India and the whole world. We have kept the medicine supply to the whole world, even in difficult times, and even when the lockdown period was there. And we were net exporters and importers of ventilators, PPE, diagnostic kits, sanitizers, and surgical gloves. And within 2 months, our industry has come up, and now we have started manufacturing all these equipments in India. And now we have started exporting also. So that is what the strength of India's engineering and entrepreneurship is there. Engineering skills and entrepreneurship is there. And we have very good API technology with forward and backward linkages and excellent logistics. Coming to USA, you are our biggest and largest exporting partner in generic drugs. Generics has saved almost $80 billion between 2018-19 and $2 trillion in the last 10 years. Even recently, I was reading the executive order of the President Trump, and I said that our prices are so low. I doubt we'll be affected by that executive order. And India has the maximum number of US FDA approved manufacturing sites outside USA. That after USA, we have maximum USA FDA approved plants in the whole world. Then we supply 40% of generic formulations marketed in USA. And India companies manufacturing facility in 20 US states with $4 billion investment. That's Zydus, Cipla, Lupin, Aurobindo, Dr. Reddy's, and Sun Pharma. I'm just giving us some. These people have set up their plant in USA, and they have actually supported USA's plan of manufacturing in India. In the last 4-5 years, huge number of investment has come up from Indian entrepreneurs in USA in this sector. Next. Yeah, so you can see, ours is a $50 billion, $50 billion US dollar of worth of industry, and we are growing. Our best thing is that we are growing at the rate of 10 to 12% in drugs and medical device 12 to 15%. So this is what you can see, that we are very, very strong and we are growing very, very fast. One reason is that Ayushman Bharat, the scheme declared by Honorable Prime Minister, which is covering almost 500 million of the population of India, and that requires medicine, that requires equipment, that requires various healthcare facilities. So that is one reason why India's healthcare industry is growing very, very fast. Next. Yeah. So India's trade with USA, we can say, we are pharmaceutical, though we are supplying $6.75 billion of brand, importing 0.3. But we are, US is a very big exporter of medical devices in India, and our medicine generic. US accounts for 33% of total export of generics, which we make to various countries. In medical devices, we import CT scan, MRI, X-ray machines, radiotherapy equipment, artificial joints, etc. from USA. And we export the contraceptive-based hormones, catheters, electrocardiogram, and statute needles, etc. Lastly, consumable items and high-end medical devices we are importing. Yeah, next. So FDI flow, you can see India, last 1 year, our FDI flow has increased almost by 100%, and our FDI is 100% automatic route as far as medical device is concerned, and in pharmaceutical up to 74, it is 74%. It's automatic route in green field, and in pharma in brownfield projects, permission is only required if it exceeds 74%. Next. Yeah, so these are the various associations we are working very closely, and we are interacting very closely. Recently, I came to USA, and I had a great opportunity to talk to the various sections of the pharmaceutical and healthcare industry. Next. Yeah, so we have come out with 2 schemes. PLI schemes in bulk drugs and medical devices. In bulk drug, we are supplying APIs and generics to USA. However, we are depending on certain countries for these critical APIs and KSM and intermediates in order to reduce this import, and that way, make India and USA both self-reliant. We can have a partnership, self-reliant in this. So we have come out with a production linked incentive scheme for 53 critical KSM drug intermediates and APIs. There's largely antibiotics and the disease, then vitamins, steroids, and very, very important medicines which are required for life-saving, medical devices. We have come out with medical devices in 4 segments. I will tell later on. Next. Yeah. So this PLI scheme of bulk drug, we have selected 53 KSMs, and the total incentive, I'm sorry, is written in crores, but this will come to almost 8 billion of this incentives will be given, and this is online. Anybody can apply, and it's a very transparent system, and the applicant will be selected on the basis of the capacity of the proposed plant. Higher the capacity, they will get the selected, and sell price of API. The lower the price, because we want the best technology, and we are going to select 136 big industry in API. I think USA has an excellent opportunity to invest in this, and rate of incentive is very, very good. This in fermentation based API is 20%. 20% of cell value. 20% of cell value will be incentive for first 4 years, and 15% in 5 years, the next 2 years. And chemically synthesized products, API is 10%. So these are very, very attractive schemes. USA, people can join as a partner, or they can individually come to us. We will help them in investing in this sector. Next. Yeah. So medical device, we have 4 segments. This is the one segment is cancer care, radiotherapy medical device. Second step is radiology, imaging medical devices. Segment 3 is anesthetic, cardio, respiratory medical devices. And segment 4 is all implants, including implantable electronic devices. And if any component which is key to such medical device, will also be considered a product. Next. Next. Yeah. So the incentive will be given 5% on the invoice value. In addition to any incentive which are state governments also. And this, minimum investment is 180 crores. That I think we forgot to convert into dollars, but anyway, 180 crores. And again, this is for 5 years. So almost 80% of the investment, will be given back to any investors. And I know that USA has very big companies which very big corporations and very MNCs who can invest in this. That is one thing. Next. Yeah. So and I should not tell. I have has been told. Our ease of doing business. We have now ranked 63rd in doing business in the last 5 years. We have improved significantly in ease of doing business ranking. In construction permit, we have become 27th. It was 184 in 2014. In the last 5-6 years, the kind of reforms which have been done in India, it has transformed ease of doing business in India. And getting electricity, India's ranking has improved to 22. It was 137 in 2014. Corporate income tax in new companies only 15%. That's all. And new companies should come, if they have to come in the production before 31st March of 2023. So this is an opportunity, only 15% of corporate tax. And our public, any new investor, if they come there, they will be benefited by public procurement order on the line of what I think USA has recently issued, that they will be giving promotion to the local manufacturer industry. So this is what, one thing I wanted to bring to the notice of everyone. We have started a pharma bureau in addition to Invest India, which is, leading in facilitating the investment in India. Because our sector is, very fragmented. You have to take a lot of permission at the state level and the local bodies and in various ministries. We have decided that any investor who comes to India, we will help them in getting all the kind of, permissions from various ministry. You need not go anywhere. The single point solution, a single point facilitating center for all investors. This is what we have decided. So it is whether pharmaceutical, medical devices, project management, FDI. So, all the permissions will be given at single point. And, we will, that is what I would like to say. Thank you very much. And I'm sure that, India and USA, which are always work very together when it comes to health and we will further increase and strengthen our ties. Thank you very much.
Thank you very much, Dr. Vaghela. We will be having many members of the audience reaching out to us with questions for you and for Mr. Baghela, our next speaker with Invest India. In fact, one of our members, Gopal Savjani of Ansh Labs, who has a series of different tests that are globally acknowledged and is now also developed an antibody test for COVID-19. He will be reaching out to both you, sir, and to Mr. Baghela, because he would like to start manufacturing in India, which is the purpose of this program, to build new relationships and create more cross-country exchanges. We had welcomed Mehek Jain and her colleagues from Invest India, both at the consulate and the partnership in 2019. And it now gives me pleasure in inviting Mr. Deepak Baghela, the MD and CEO of Invest India, to make his remarks. On to you, Deepak Baghela from Invest India.
Thank you, Jagdeep. True pleasure, and a very special thank you to you and to our CGI there for getting us all together. Very timely, and I must say, very important. Excellency, always a pleasure to see you and hear you, and for you leading us in our entire efforts. We have distinguished panelists today, and it was a pleasure hearing them, and especially our very senior government officials. Both from the central government, we have Secretary Vaghela, and from my state governments. And let me tell you, the reason why you have such senior level presence is to show the importance of this very special relationship. It's very, very critical for us. I don't have any slides. What I thought I'll do is, I'll just share with you something of what Dr. Hotez mentioned about this little virus and how it has changed our entire lives. Today, we are on day 140 of the most unprecedented lockdown ever in human history. And what has happened in India during these 140 days is also unprecedented. But before I get down to that, Dr. Hotez mentioned about how this virus is moving across India. I thought I just got some latest statistics and I must share them with you. Because we went into an early lockdown just to let you know how it is working out in the Indian context. India is divided into 729 administrative districts. That is how we are. And we have this is further into 28 states. But let me take you to those 729 districts. Only in 11 of those 729 districts do I have over 5,000 cases today. In fact, in close to 200 of these districts, that is 192, I have less than 50 cases. And in 23 of them, I have a 0 case. The interesting thing is that and I have 28 states and 8 special territories, as you know, but today 2/3 of my entire virus has been contained within 5 of those 28 states. So this early lockdown, we never know how this virus behaves, as we all know. But as of now, and God be with us, we've been able to contain it to a point where hopefully we will be able to get out of this virus in a U or a sharp V if we are lucky enough to be able to do that. And this containment has been good. Now, before I tell you what has happened within these 190 days, let me just step back as to what had happened before this. March 2020, we close our financial year in March. I closed with an FDI of $74 billion. It's the highest ever FDI I've got in my history. I mean, over 90% of that came in open route. That meant it did not require any special approvals. We retain ourselves as one of the most open economies on the planet, with the private sector having the ability to play a role in each and every sector of my economy. The other interesting thing of that 74 billion, and I'll just take 5 minutes with your permission, Jagdeep, of that 74 billion is that my share in FDI went up 18%, while global FDI was going down by 7%. Why was that happening? And there's a reason why I'm telling you this. The reason is that we were the largest, fastest, and youngest. We are the largest single consumer base in the democratic world. By 2025, I'll be 1.5 billion. I'll be the largest within a single national boundary, at least for the next 100 years. I'm the youngest. My average age is 29. Of that 1.5 billion, 1 billion are under the age of 35. And I was the fastest growing large economy before we went into the virus on the planet, and we looked to ourselves to be able to retain that position very quickly. But what happened during these 140 days? In addition to those three pillars, which I told you, fastest, youngest, largest, the government led by our Prime Minister has decided to strengthen our fourth pillar, which is to make the investment journey, to make the investors' journey easiest. And that is where during these past 100 days, there have been unprecedented reforms announced, both in my state governments and my central government. And each of those reforms have been to make that investor journey as simple as possible, and for you to be able to access that market as simple as possible. There be single windows, which the secretary mentioned, where you can get all your approvals. I have state governments which give you all approval in deemed timeline. That means if they tell you it will be done in 40 days, it's done in 40 days. If you don't hear from them, all approvals are given. Special industrial clusters have been set up where you can just come and plug and play. We are creating a portal where you will be able to see the entire land bank available from sitting wherever you are in the world. At Invest India, I have a special team for you, where each one of you, and I've been working with a number of you who joined us today with those small screens, which I can see some of them and I can see them on that list. And we are working very closely with them. Jagdeep, you mentioned some of them and some of the others are there. I must tell you, for each one of you, I will give you a dedicated relationship manager, which will work with you through your entire journey in India to help you, show you the opportunity, to get you the land, to get you all approvals, to get you a partner, to get your business started. And at any point of time, even after that, this will be the person who will walk with you right through your entire journey. In addition to that, the secretary mentioned some very interesting policy initiatives. He's just announced those. And by the way, this policy was made with a lot of stakeholder inputs, and a number of them are here with us today. So this policy now, the way they have made it so attractive, which is performance linked and production linked, and on the tax, we told you India today, they've reduced it to 15% for new investments. On every which way, be it financial, be it a ease of doing business, be it a market opportunity, India today is now become the preferred destination. And what am I seeing in the past 140 days? Just to let you know, I will be doing a 3x of my team in the next 180 days because of the number of investor interest globally, which I'm seeing, especially from the US. And Jagdeep, why is that happening? Because one of the things which this virus has done is it has brought to fore that entire thing of de-risking your supply chains. And I'm seeing a number of businesses moving their supply chains, onshoring them to India and moving them really fast. Very quickly, I know I may be running out of time, but Susan, you mentioned about the largest medical center in the world in Houston. I had the privilege to visit it. I was there late last year when our Honorable Prime Minister was there. I want to invite you to India. Let's create a new world record. Let's together join and create another new world's largest one together. And Emily, you mentioned about innovation. Let me tell you, we are one of the youngest nations on startups. Startup India was launched by my Honorable Prime Minister in January 2016. But in a period of 4 years, I'm number 3 in the world in terms of unicorns. I'm number 2 in the world in number of startups. I'm number 1 in the world in new startups adding every day. Come join hands with us. In the past 50 months, India now is the number 1 R&D destination in the world for global multinationals having their R&D centers outside of their headquarters. What I'm saying, come and join hands with us. We will work together and we will show you the strength of India's innovation, frugal innovation, not just creating solutions and the best solutions for the people of India, but for the entire world. I really look forward to working with you on all this. I do want to let you know, we are at a very important inflection point in India. We are at the gateway of a new India. Join hands with us as we create this new India. You are our special partners. We will work together and we promise to hold hands to make it happen. Thank you again, and we are here for any questions.
Thank you, Deepak. I do want to confirm for the benefit of the audience that Invest India is very serious about what they do. In fact, Mehak and her team who had visited us in 2019 is very prompt in her follow-up. There is only one fact that I want to correct, Deepak. There was one error. All the credit for today's event goes to the Consul General, Asim Mahajan. The Indo-American Chamber, the other chambers in the US and India supported his efforts, but I want to give him the credit for being the brainchild and helping put together today's event. For the benefit of the panelists, we have a request if you could please stick to your allotted time, because we do have a lot of questions that have come in. We do have a post-event session that we want to host. It looks like we will be running a little over the allotted time right now, but the humble request to all the panelists is if you could please stick to the allotted time, it would help us finish and then move on to the next session. Our next speaker is Mr. Ram Subhag Singh, the Additional Chief Secretary, Government of Himachal Pradesh, India. I now hand over to Mr. Ram Subhag Singh from Himachal Pradesh.
Thank you, Jagdeep. Thank you for inviting me to speak. Dr. Waghela, Secretary, Department of Pharmaceuticals, Ambassador Taranjeet, Consul General Asim, Mr. Deepak Bagla, all my friends in US, Jai Hind, and a very good morning to all of you in US, and good evening to my friends in India. The way the discussions have taken place so far, I feel it a little strange to put forward my state's perspective, because I think that we should look as India as a whole, and this is the right time for us to collaborate on, particularly on pharmaceuticals, bulk drugs, and medical devices. But my state has a very unique place in the geography of our country. It's a beautiful hill state in the Himalayas. May I please request the Consul General staff to, yes. So next slide, please. Yes. So next slide, please. Yeah. So my contents are that today's presentation, I will talk of Himachal Pradesh at a glance. You can see and appreciate the beauty of Himachal. It is nestled in the lap of Himalayas. It's a beautiful hill state with a very nice weather. In fact, as I speak to you, the weather in Shimla here is about 16 degrees centigrade. Next slide, please. It has excellent air and water quality. It is very low in the greenhouse emissions. 67% of our state area is under the forest with very rich biodiversity. Next slide, please. Yes, and the economic indicators of the state speak for themselves. Our state economy, it's a small state, but its economy is $25 billion. Its economic growth and per capita income growth is higher than the national average. It is third in the Human Development Index in the country, first in the northern states of India, and it is second on the UN Sustainable Development Goal. So what I want to emphasize is that on the social inclusion and economic indicators, we are doing well. It has a very robust manufacturing sector. We are home to about 25 global corporates. We have 30% contribution in the state economy comes from manufacturing. Though the state is primarily hill state, but it has an extremely conducive industrial corridor with a width of about 10 to 20 miles and a length of about 150 miles. So in the foothills of Himalayas, in the districts of Solan, Una, Sirmaur, it has an excellent industrial corridor that has developed. You can see the prominent players in this state, the multinationals that we have. Coca-Cola is here, Cipla is here, Abbott, Nestle. I need not repeat these names for the sake of brevity. Next slide, please. The pharma sector in Himachal is extremely important. We are the Asia's largest pharmaceutical hub, and we cater to 38% of Asia's demand from Himachal. 40% of total drug formulation manufacturing in our country happens in Himachal Pradesh. We have 14 US FDA certified units. We have 202 WHO GMP certified units. We have 18 MHRA units, and we have 3 active pharma ingredients manufacturers, bulk drug manufacturers in the state. We are looking at, as I talk to you, the dream that I have is to have bulk drug manufacturing as a backward integration for my pharma sector. And there is a huge potential to manufacture medical devices in this state. I also look at the biotechnology park in this state. So what are my advantages? What is it that I have to offer? We have abundance of power. We are a surplus state with surplus power state. About 500 million units is the surplus power that I have. We have clean and green power. 90% of Himachal Pradesh power comes from the hydro sector. And we have the lowest tariff for power in the country on an average. Abundant water, perennial rivers, and on the top of it, very recently we have identified 3,000 acres of land, which is easily available with the industries department of the state for setting up a bulk drug park of other pharma manufacturing products and medical devices. So power, water, and land. We have good connectivity. We have at a distance of about an hour, 30 to 35 miles, the international airport at Chandigarh. We have excellent network of heliports in our state. There is rail connectivity and road connectivity by national highways, where I'm proposing to set up in my industrial corridor the bulk drug park and the medical devices park. We have a very competitive industrial ecosystem, high capacity utilization in pharma sector, which is better both if I compare it with US and China. We have a manpower where the average wage rate is lower than China. We have cordial industrial relations. There has hardly been any incident of industrial lockdown in Himachal in the recent past that I can remember. We have an excellent manpower available. There are skill development centers, pharma testing labs. We have excellent linkage with the R&D institutes like the CSIR. There is an availability of common effluent treatment plants, inland container depot is there, and we have a set of labor hostels all across the industrial corridor. We have policies which are supportive of investment. We will give rebate on land. There is an interest-free payment schedule. There is an interest subvention on loan. The power tariff rebates will particularly be given in addition to what is present to the bulk drug manufacturers and the medical devices manufacturers in case any US company wants to set up a manufacturing unit in our industrial corridor. We have subsidies on transport, environmental compliance, employment, and patent filing. Next. Next, please. Yes, and we have a single window clearance system, online approval. I have decided, the Chief Minister of Himachal Pradesh has given me this direction that for any investment coming above $50 million, we will give you a dedicated nodal officer to make sure that your industry is set up without any hassles, without any problem. We have an investment promotion cell also for handholding. There is a self-certification for setting up ventures with turnover over $35 million. So there is no need to get any clearance from anybody during the time that your venture is under construction. This is the presentation that I had. I hope I have not exceeded my time, Jagdeep, but thank you very much. I look forward that interest will be shown from our US partners, and I am here to support the setting up of various units which want to come in medical devices and bulk drug formulation units in Himachal Pradesh. Thank you, and thank you once again, Ambassador Taranjeet and Consul General Asim, for organizing such a wonderful interaction.
Thank you very much. I'm now moving on to the state of Andhra Pradesh. In 2017, we hosted a high-level delegation from Andhra Pradesh, led by Prasad Garapati. And today it's our privilege to welcome Mr. R. Karikal Valavan, the Special Chief Secretary, the Government of Andhra Pradesh, to make his presentation.
Thank you, Mr. Jagdeep. Good morning to all of you. His Excellency, the Ambassador of India, Mr. Sandhu, the Consul General, Mr. Asim Magajan, ladies and gentlemen, good morning to all of you. In fact, it's a privilege for me to address this August gathering. In fact, the state of Andhra Pradesh, the Indian state of Andhra Pradesh has got a strong presence in the state of Texas, especially in Houston. Almost all the hospitals are headed or having the strong presence of doctors from Telugu community. And we have a very strong Telugu diaspora in the US. Back home, the Indian state of Andhra Pradesh has got a very proactive government headed by a young and dynamic Chief Minister, Y.S. Jagan Mohan Reddy. And this is evident in the recent COVID crisis. We have the largest number of testings done and highest rate of recovery and the lowest rate of mortality. And this has been I'm sorry, the next slide. Next. So our efforts in tackling the COVID has been appreciated by one and all, by Flipkart, by Isuzu, by many channels, media channels. And even during the COVID crisis, our government has supported the industries by providing 1,200 crores as incentives to the MSMEs. Next. The strength of the Andhra Pradesh is we are the 8th largest and our size of economy is $138 billion US. We have second longest coastline and 27% higher than national average, our per capita income. Our urbanization is moving towards 50% and we have 67% literacy rate. Next. The competitive advantage of Andhra Pradesh is we have a huge land bank. We have nearly 45,000 acres available with us. We have 2 industrial corridors running across the state. One is Vizag-Chennai Industrial Corridor and Chennai-Bangalore Industrial Corridor. So more than 300 industrial parks are there and 10 special economic zones are there. They are functioning very well, very successfully. The competitive advantage can be seen in the skilled labor wage is very low, very cheap labor available, and water charges is 0.6 US. Land cost is also 10,000 to 13,000, and energy charge is 0.1, and then KVA demand charge is 6.8. Next. So today we announced the industrial policy for the state of Andhra Pradesh for the years 2020 to 2023. We announced many incentives for various industries, and we also provided land at very cheap, land on lease in the beginning, and after successful completion of operation for 10 years, they became eligible to buy the land. And we have tailor-made incentives for the mega industries. Next slide. This is the next slide. This is actually the highlight of our industrial policy is YSR AP1. It's a end-to-end business facilitation. It is basically a multifaceted business enablement center in which we provide all kinds of support to the industry, to the existing industry, to the upcoming industry, and the prospective industries as well. We provide the market research, we provide the market support, we provide scheme support, we provide sales support, and we provide the services the approvals within 21 days. And our compliance of our SLA is nearly 99.3%. And we have been number one in ease of doing business for the 3 consecutive years. If you see the pharma ecosystem in the state of Andhra Pradesh, we have a strong presence of pharma industry, and we are supposed to be the pharmaceutical capital of India. 250 plus API bulk drug units are there, out of which 38 are WHO approved and 20 USFDA approved. The 16% of India's production comes from Andhra Pradesh, and 6% of national exports happen from the state of Andhra Pradesh. And so far we attracted nearly 18,000 crore, 2.5 billion investment in pharma sector. We generated 88,000 direct employment. So we have proposed bulk drug parks in 3 locations. Next. So the Jawaharlal Nehru Pharma City is the first of its kind in the country, and it houses nearly 104 pharmaceutical companies, and some of the companies are Biocon, Orchid Chemicals and Drugs, Sassoon Chemicals, Mylan, GVK, Hetero, and APZ, the Special Economic Zone, Achyutapuram is another major pharmaceutical hub in which Laurus Labs, Vasudha Pharma, Plantax, Leaf Farm, all these major industries are accommodated. The third one is Paidi Bhimavaram in Srikakulam district. We have Arbindo, Dr. Reddy's, Andhra Organics, and all located there. The fourth one is AP Special Economic Zone at Noidapet, Nellore, which again, houses Anvita Life Care, Gel Caps Industries, KEMSI. So these are all the major industries where we have. We are also strong in chemical and petrochemical ecosystem. So ours is the first PCPR region notified in the country, and we have nearly 630 square kilometer of area allocated for this PCPR. Next. In the healthcare sector and skill development, we have a lot of initiatives taken. The healthcare for eye care, for our Arogyasri. Arogyasri is the medical healthcare scheme that has been announced by Government of Andhra Pradesh. This is very well appreciated scheme, and these are all the key initiatives we have taken up. And the skill development, we are establishing nearly 30 skill development centers with the 2 skill development universities. So these universities, we have created an exclusive department for skill development, which is headed by a very senior officer. And we have the digital employment exchange where the industry and the requirement, the industry and the government can meet. And our Andhra Pradesh MedTech zone is the #1 integrated medical devices manufacturing park. So it is the first of its kind in the country, and we have 270 acres of in 270 acres it has been established, and these are all the areas where we can collaborate: radioisotope, CT scan, GEM, and we have provided jobs for 14,000 to 20,000 in this AMTZ, and nearly 85 companies have established their industries. 22 have become already operational. So with this, I welcome these are all the major companies which have their presence in Andhra Pradesh MedTech zone. So I thank everyone, and I would like to have collaboration with the state of Texas in US. Thank you very much.
Thank you very much, sir. I would now like to invite Mr. M.K. Das, the Principal Secretary, Industries, Government of Gujarat, India. Houston has a long-term relationship in highlighting vibrant Gujarat to Houston business leaders. And now we invite Mr. Das to talk about the opportunities in healthcare. On to you, Mr. Das.
Good morning, friends in USA, and good evening, friends in Delhi. in India. I'm very happy to present before you why you should come and invest in Gujarat. India and USA, they have a great relationship. They are the biggest democracy, and we are lucky to have Honorable President Trump in our city to inaugurate world's largest cricket stadium recently. We had the Honorable Governor of State New Jersey visiting us, and Honorable Secretary of State Delaware also visited us, and we had sister state agreement with them. Next. I will say why Gujarat. Gujarat has only 5% population of India, but as you can see, we account for 17% of India's industrial output, 21% of India's export. Last year alone, we had 240% growth in FDI, foreign direct investment, into Gujarat. And if you include domestic investment also, we had 333% increase over the previous year, which is very impressive. Our GDP growth was 13% last year, and it has almost doubled in the last 5 years. We are home to 60 plus Fortune 500 companies, and we have a very strong MSME base, almost 3.5 million users there. We have got natural gas, water and power grid. We have power surplus since 2006. We have identified a lot of land, almost 330 square kilometer land. Wait. We have 330 square land is there, and we have got 48 large ports, 19 airport, and we have got a lot of talent pool. The important thing is the skill base, and we have got huge talent pool here, and we are investing in futuristic market also. Gift City, Delhi Mumbai Industrial Corridor, new ports, green energy. We are investing a lot. We are going to have 30 gigawatt of hybrid power, solar and wind power very shortly. We have allocated land and work has started. Next slide, please. The business is showing more confidence. There is more business from USA to India, and we have got 120 US companies across various sectors. FDI inflow from USA has nearly doubled to $2.1 billion in last 7 years. And then companies are Ford, Bank of America, Citigroup, P&G, Oracle, all big names are here. And we are collaborating in the field of chemicals, petrochemicals, pharmaceuticals, textile, and many other sectors. Our government is very proactive. For the new incoming industries, we have exempted them from operational labor laws for next 200 days to have ease of doing business. For all SME company, we have said that you don't need any permission. You come and start operation, take permission next 3 years. Our IFP portal is very, very useful. We have given 500,000 permission in the last 2 years. It gives permission in 16 different departments. And I'm happy to say that when the CEO of Bank of America came to inaugurate the office in Gift City, Ahmedabad, she said that they got permission in 7 minutes. We appoint a dedicated nodal officer for each big investment. We are top performer as far as water management is concerned. And we'll let you know that I'm happy to tell you that yesterday only we have announced a new industrial policy. Our policy has been very good. As you saw that we have got a lot of FDI and investment in last few years. But to even maintain momentum and increase the momentum, we have now started and added more features in the new policy. What we have done is try to reduce the cost of doing business. The cost of business in Gujarat of a pharma sector is at the most 1/3. The cost that we have got in US and Europe, it's 1/3 at the most. We have 53% of India's medical device, 40% of India's pharma machinery. Then 60% of orthopedic implants are being produced in Gujarat. So we are a big leader in the pharma sector. Next. Our industry turnover is $75 billion as of now. We have got 4,550 licensed manufacturers. Our share in India's pharma output is 33%, export is 28%. Now we want to further it. And the US FDA have been improved 130 cases. We are doing quite well. So far healthcare sector is concerned, the costs are very low. Medical treatment is very cheap compared to other countries. The zero waiting period for all patients. We have become a hub for the medical tourism. We get patients from Africa, UAE, UK, Southeast Asian countries. Our doctors are well trained. They've got a good number of paramedical staff. And we are doing quite well in cardiology, neurosurgery, eye surgery, etc. Now we are going for a bulk drug park in western part of Gujarat, Bharuch, and we have made a new health policy. Of course, we updated the policy here. Idea is to attract more foreign investment and consolidate our strength. We are giving assistance to doctors in making, we reimburse the electricity for the new colleges. Our idea is to have good medical college in every district. And we are going for both brownfield and greenfield projects. We are going for latest equipments in all the hospitals. And we have taken a number of initiatives by state government again, so that average age increases, quality of life increases, and everybody gets access to high quality medical services. And we have also gone for a PPP model. Next. What I wanted to tell you here is that Gujarat has number of MNCs and domestic players. We are one of the biggest manufacturers and biggest exporter. We are in ease of doing business, we are ranked very high. Our chief minister has told us in fact, that we must be most competitive. Everything must be digital. All the approvals must be online. And accordingly, we are working ahead. Already we are producing a number of things, stents, medical implants, test equipments. We can further work in the field of stents, syringes, APIs, biogenerics, vaccines, etc. We are going to have a big pharma park and medical device park very shortly. We have acquired land for that. And as the sea is very near to us, it's very easy for us to dispose the waste also. We have got good ports, allowing us to have import and export. We are well connected. The number of airports and port. And best thing is that we have got very good base of entrepreneurs. There are big people like Jaidas, Torrent, Ranbaxy, they all are here, Sun Pharma, they all are here and they have got big units here. So we can have new units coming from MNCs and we can have joint venture also. We would like to give all support. Whatever question you have got in terms of whether it is environment clearance, linkages with input and output, we'll be more than happy to provide you. We have got a special team, Index B, they will provide you all help and assistance. Thank you.
Thank you very much, Secretary Das. I would like to remind all the panelists from India that the opportunities are across the USA. Though it's being hosted by the consulate in Houston, the opportunities are across the USA and there are opportunities with India in various states, as was evident by the three presentations we had today. At this point, we are now moving on to a very important junction where we are inviting 3 American companies that have invested in India, followed by 2 Indian companies that have invested in the USA to make brief presentations. And after this, we will follow with some questions. I realize we are going over our planned time, but the topic is so important that we would encourage everybody to stay on till the end of the program. I would now like to invite Mr. S. Sridhar, the Managing Director of Pfizer India, to talk about his experience of doing business in India. Mr. S. Sridhar from Pfizer.
Thank you, Jagdeep. Good morning, good evening to everyone. I thank the Indian Consulate and USIBC for this platform. I represent USIBC and Pfizer. US-India Business Council was formed in 1975 at the request of US and Indian government to represent top global companies operating across the United States and India. USIBC is led by President Nisha Biswal and serves as the premier voice of the industry. In today's context, what has come to the fore is the importance and the value of innovation. In India, we are seeing an unprecedented R&D effort trying to discover vaccine for COVID. This is a big step change and has reinforced our industry in the direction of innovation. We can call this a global innovation momentum translating into India's innovation momentum. It is important to keep this innovation momentum going. There are 4 areas I'm going to highlight in the operating environment, which, if strengthened, can bring significant boost to sustain this innovation environment. First, regulatory policies. Our global regulatory policies need to transition quickly. A marriage of Indian regulatory policies to the global policies, with fast-tracking India's membership to ICH, which will enable fast-tracking new drug launches of both Indian and global companies. Increased reliance on real-world evidence, standardization of clinical trials rules, and more importantly, revamping Drugs and Magic Remedies Act, forward-looking policies on digital health and telemedicine, and enabling direct-to-consumer campaign for common remedies. The second is intellectual property. A world-class IP environment is important for all companies. We have seen strengthening of IP system in India in recent times. Further adoption of some of the best practices and standardization of some of the laws, as is practiced in a lot of countries around the world in terms of patent grant, patent information system, will significantly enhance India's image and enable innovation-driven healthcare environment. The third area is pricing. India's pricing policy needs to adopt newer approaches. The concept of tiered pricing for different segment of population, differential pricing, outcome-based pricing model are the need of the hour. This requires complete revamping of the current pricing model. And the last area I would say is strengthening public healthcare. Ayushman Bharat is a bold step towards universal healthcare. I hope Ayushman Bharat 2 would cover middle income segment of the population. Pharmaceutical companies, including innovator companies, should be encouraged to offer differential pricing to Ayushman Bharat beneficiaries without the fear of price referencing. Public-private partnerships in the area of preventive healthcare, immunization, health and hygiene should become the new chapter in the public healthcare program. I would like to thank everybody for the opportunity giving us to speak to me. Thank you very much.
Thank you very much. I now invite Mr. Mike Mehta, President and CEO of Phoenix Healthcare Solutions, to make his presentation. Mike Mehta, please.
Thank you, Jagdeep. Good morning to everyone in the US and good evening to everyone in India. I'm Mike Mehta. I'm the President and CEO of Phoenix Healthcare Solutions. We have our own manufacturing facility, 100% wholly owned manufacturing facility in Navi Mumbai, India. In 2011, we wanted to relocate our manufacturing facility from China, and we looked at several options in Asia, and then finally settled on India. We thought that we could have access to a educated English-speaking workforce, good management cadre people, as well as access to a large existing domestic market. We manufacture a full line of medical devices and OTC products registered with the US FDA. And our products are sold in the United States, Europe, Brazil, and several other countries of the world. Our US FDA facility consists of around 75,000 square feet with around 8,000 square foot of a class 100,000 clean room facility. With this facility, we serve the US retail market, the alternate care market, the primary care market, as well as several other international markets in the world. When we set up the facility in India, it was not an easy road, but as time has passed, we have seen that the ease of doing business in India has gradually improved. And we are at that stage now where in the next year or so, we would be looking to set up an additional facility somewhere in India. And that is why it was so interesting to note the presentation of the three states, the state of Himachal Pradesh, Andhra Pradesh, and Gujarat. For us to be able to make a decision as to which state that we would like to set up our second facility in India. Along with manufacturing a full line of wipes, primarily for the US market, we have launched India-centric products like digital thermometers, nebulizers, pulse oximeters, steam vaporizers, blood pressure monitors, that basically we have been able to sell to our Indian customers during this time of COVID. Therefore, we have seen that supply chain in India has gradually developed and improved. There is certainly a ways to go, but we can see that the supply chain is rapidly improving to help meet the demand. And I think this would greatly foster the Indian-US partnership going forward. Thank you very much. It's been a pleasure to be associated with this panel. Thank you.
Thank you very much, Mike. I would now like to invite Mr. Ravinder Pal Singh Dang, Managing Director, Baxter India, to also talk about their experience of doing business in India. Mr. Ravinder Pal Singh Dang, Baxter India.
Thank you, Jagdeep. Jagdeep, I just want to check. Can you hear me clearly? Thank you. First of all, I just want to thank for the invitation we have received for speaking on this forum. I'll be brief. Before starting out, I just want to thank a few people who have made this possible. I want to thank the Ambassador, Taranjeet Singh Sandhu, the CGI Houston, Mr. Mahajan. There are some dignitaries here who spent time and talked about the possibilities in India, and Dr. P.D. Vaghela, the leaders of the three states, Mr. M.K. Das, Mr. Walaven, Mr. Ram Subhag Singh, and other leaders and friends. It's a great moment to be here. Now, I'm going to speak in two capacities. One is as a member of the US IBC Advisory Council. And the other part I'm going to talk about is about Baxter. As part of the US IBC Advisory Council, we are a group of thought leaders who help in advancing growth of trade and investment possibilities in India. We lead engagements like today. We also do program direction when we discuss with Nisha, and then they talk about all the programs, and we do that. Right now, the world is undergoing a global pandemic. Therefore, we are working very closely with the Council to channelize the US IBC response to this. Coming to Baxter. If you look at Baxter and the experience of Baxter, we've been in India since 20 years, 1997 to be precise, and more than 20 years. We've engaged with stakeholders across the healthcare ecosystem. Now, if you want to look at the headline of what Baxter is about, while we started out as a commercial operation, but then we found more opportunities in the country and we expanded our presence. So if you look at the fourth bullet points right on the top part of the slide, we've got commercial operations in Gurgaon, and these commercial operations serve population across India, and in some very innovative ways and in ways which drive both affordability and accessibility to populations not only in India but also in South Asia, which includes Nepal, Bangladesh, Sri Lanka. And we work very closely with governments and with private sector to advance healthcare in the country. We acquired Claris in Ahmedabad, and I've been in touch with Mr. M.K. Das for a few meetings. We have a very large operation in Gujarat through our manufacturing generic injectable facility, which is a very large facility and exports to more than 63 countries across the world. We make top of the line injectables, which are exported, and we've been supporting essential medicines across global supply chains. The third area where we have engaged deeply, and I've seen a lot of leaders talk about today, is the research and the R&D talent in India and the possibilities of R&D. Baxter is there. in terms of R&D in a fairly large way in Bangalore. And then we also have a big IT center, which is a global IT center, which is serving the needs of Baxter across the world. And we support the enterprise-wide IT solutions out of Bangalore. In terms of policy and local regulatory support, we've been engaged very closely with regulators in terms of both supporting the conversation and shaping the conversation. Let me give you a few examples there. When you look at Prime Minister National Dialysis Program, which was launched in 2016, we've been partners in working on that program along with Health Ministry and state bodies. Ayushman Bharat is something we work very closely with, and we are associated with Ayushman Bharat and Dr. Indu Bhushan, whom we talk very regularly, in terms of what we can do to drive access of the program and also look at possibilities of affordability, something which Sridhar talked about a few minutes back. We are engaged with national and state policymakers through various engagements. Insurance regulator is another area where we work very closely. How do we drive deeper insurance penetration, again, to build affordability of healthcare in the country. In terms of raising quality standards, we're working with Bureau of Indian Standards for developing local standards which are aligned to international standards. So a wide range of policy measures we are engaged with. And the last part is our community engagement. So Baxter is not only looking at India from a point of view of engaging on commercial basis or on shaping policy, but when we look at a few programs, whether it is Project Srujal, which is about 11 villages in Gujarat, or working in Howrah with more than 75,000 girl child and providing free spectacle care. We work with and Project Smile, which takes care of cleft lip conditions. So Baxter, as you can see, is engaged in multiple ways in being in India, and it's been a very fruitful partnership for us of being in India for more than 20 years. So back to you, Jagdeep, and thank you again for this opportunity.
Thank you very much, Mr. Dang. Our next speaker now will be speaking about the Indian experience of doing business in the USA. And we have Mr. Jaswinder Matharu, a member of the board of directors of Cadila Pharmaceuticals. On to you, Mr. Matharu.
Well, thank you, Jagdeep. Well, good morning to everybody in the US and good evening to our colleagues in India. So I wanted to thank everybody for giving us the opportunity to come and speak about our experiences in the US. I helped Cadila pretty much grow in the US side of the business. And something about Cadila. Cadila, as most of you may know, is one of the largest privately held pharmaceutical companies in India. And it was founded on the principle of bringing quality, low-cost medications to the developing world. That was the dream, and that was the vision of the founder. And I think Cadila has been delivering on that promise for over 60 years with the help of over 8,000 employees worldwide. So in delivering that promise, Cadila has developed a very broad range of capabilities, especially in the areas of research and development. And as you know, that there is a big push of innovation and research and development in this COVID environment. We are very cognizant of the fact that this environment will get over in a period of time, but healthcare will continue to be an emerging need for both the developed world and the developing world. So in addition to our R&D, we have developed a lot of manufacturing capability in India, and I'll talk about our US investments in a minute. And these R&D capabilities in India have finished formulation plants, meaning about 6-7 of these plants throughout India, with one of them in Gujarat, which is FDA approved. And we have our own API manufacturing facility also in Gujarat, which is fully FDA approved. And to bring kind of totally vertically integrated products to the market, we also have our own CRO, which is also fully FDA approved. So our goal was to basically provide a full set of capabilities to the healthcare industry. So as far as the R&D collaboration is concerned, we have collaborated with many organizations, and I'll give you 2 examples in the US. As you may be aware that Novavax is one of the candidates, which is in the Warp Speed program for developing a vaccine. So Cadila was a kind of an initial investor in Novavax. In addition to our investment, we also did a collaborative R&D effort to develop the base platform on which the current COVID vaccine is getting developed. We are not participating in the development of the COVID vaccine per se, but the platform that is getting used to develop the vaccine was actually developed in joint collaboration with Catalent Pharmaceuticals. And currently, we also have a joint collaboration going on with Stanford School of Medicine, where we are taking one of our therapeutic products and doing a preclinical trial of efficacy on COVID-19. So that's kind of our collab, and that collaboration is ongoing. And we have recently, started the construction of a manufacturing plant in the US, which is being set up in the state of Maryland, right? So, in addition to kind of all our investment in therapies and therapeuticals, right? We also are very aware that the next set of healthcare will require adoption of technology, and we are integrating, adjacent technology like big data, machine learning, and artificial intelligence in pretty much every phase of our operations, from accelerating drug development to optimizing manufacturing to de-risking our supply chains, right? And to generally kind of optimize the performance of our workforce. Because I strongly believe that there needs to be a complementary approach to the current paradigm in healthcare if we are going to keep up with the demands, which are increasing for healthcare across the globe, especially by way of innovation and by way of cost cutting. So Jagdeep, thank you so much for letting us come and speak about the company. I will turn it over back to you.
Thank you very much, Mr. Matharu. Our last presenter today will also be talking about the experience of an Indian company doing business in the USA. But after he finishes speaking, I would urge everybody to stay back and listen to the question and answer session, because all the speakers we have heard till now will be responding to some questions we have received. And this session, once it finishes, after the Consul General makes his closing remarks, will be followed by another interactive session giving the audience the ability to have a dialogue with the panelists. You will receive a separate invitation to that if you already have not. So in the chat box, put in a request with your email address if you want to be invited to that session. With that, I now move on to the last speaker in the session before the interactive question and answer session with the panelists. And the speaker is Dr. Sanjay Gupta, the CEO of Torrent Pharma in the USA. On to you, Sanjay.
Thank you, Jagdeep. Distinguished guests and participants, today I'm representing Torrent as well as the Confederation of Indian Industry, also known as CII. In 2020, CII celebrates 125 years of working on shaping India's development journey and proactively transforming Indian industry's engagement in national development. I would also like to thank the 3 states that presented earlier today. Torrent has large industrial facilities near Ahmedabad and Vadodara in Gujarat, at Baddi in Himachal Pradesh, and at Vizag in Andhra Pradesh. We have found these state governments to be invaluable partners in our growth journey. To introduce Torrent, Torrent is the 7th largest pharma company in India, with annual revenues exceeding $1 billion. We have major operations in 4 markets: India, Brazil, US, and Germany. We started exploring opportunities outside India in the early 2000s, and the US was a top priority. It is an attractive market as it's the world's largest generic market, with a size exceeding $50 billion. 55% of Americans regularly take a prescription medication, and those who use a prescription drug take 4 on average. It is one of the rare markets that offers market-based pricing and also has the highest regulatory and quality compliance standards, which once met can help you do business anywhere in the world. Initial years provided very expensive lessons for us on how not to do things. We failed FDA inspections, our compliance culture was inadequate, and key elements of our marketing strategy, products and pricing, were suboptimal. We sold our first product in 2008, and success came to us in small steps. I would like to share a few lessons learned along the way. While the US has plenty of talent, however, it is not evenly distributed. For a particular sector, there may be 4 or 5 clusters with the requisite talent. As a newcomer, we found it better to plug into an existing ecosystem. In pharmaceuticals, the number of customers is small, but their size is huge. While it is hard to break into the market, once we are established with one of the larger buyers, it can really move the needle for our organization. I personally spent many years cold calling Walmart before we got our first contract for the US market. One aspect of doing business in the US that I enjoy, but it can sometimes be challenging, is that realities evolve, and every few years one is faced with an altered landscape. Customers merge or demerge, the regulator raises standards, there are newer unexpected competitors. So being swift-footed and comfortable with change are requisites for long-term success in this market. In 2018, after 10 years of direct commercial presence, we took the next step and acquired a manufacturing facility in Pennsylvania. In our experience, US manufactured products are cost competitive, but one has to be careful with the product mix. We chose to manufacture controlled substances, which by law have to be manufactured in the US, and we also chose liquids, which are expensive to transport across oceans. Today, 2 years later, we have a completely upgraded facility with about 120 employees. We are very optimistic over the long run for the US market and our US business. There will be setbacks, but no other market in the world provides this high level of opportunity and potential rewards. Jagdeep, thanks. I would start.
Thank you very much, Dr. Gupta. I, at this point, want to thank all our panelists. I want to thank the Consul General and the Ambassador for putting together today's event. I want to thank all our sister chambers, both in the USA and in India, who collaborated to get the panelists together. And at this point of time, I will be handing over for the interactive session to Neil Gonu-Guntala, an attorney and currently serving as the president of the US-India Chamber of Commerce of Dallas-Fort Worth, which is one of the 4 original IACCs formed 21 years ago in our southern United States. I say thank you to the Consul General and all of you for giving me this chance. And from this point on, I hand over to Neil from the Dallas Chamber.
Thank you, Jagdeep Ji. Good morning, Ambassador Sandhu, Honorable Consul General, and good morning and good evening to all of our distinguished guests and friends in the US and in India. I appreciate our partnership in helping to promote US-India trade. As Jagdeep Ji mentioned, my name is Neil Gonu-Guntala, and I serve as the president of the US-India Chamber of Commerce in Dallas-Fort Worth, an organization that supports business expansion into North Texas and facilitates investments into India, working with partners like Invest India and others. At this time, it gives me great pleasure to moderate today's conversation to further understand how US and Indian companies can invest in India and in the US respectively, thereby enhancing bilateral trade between these two countries. The first question in today's moderation goes to Dr. Vaghela. The Production Linked Incentive Scheme, PLI, is designed to promote domestic manufacturing of critical pharmaceutical ingredients in India. During your presentation, you shared a number of incentives that the government of India is offering for US companies who are looking to invest with this particular scheme. For those companies that are interested in investing, one of the questions we have received is, do those companies need to form a joint venture with an Indian company, or can they invest on their own? Dr. Vaghela?
Yeah. Thank you very much. It's a very good question. Foreign companies can, on their own, also apply and take the benefit of the scheme. The only thing is that they have to get registered in India. This is one thing. Secondly, if they want to form a partnership with Indian companies, that is also welcome. So either if they have to get registered in India if they want to do that.
Thank you, Dr. Vaghela. One more question for you. How can experienced medical and pharmaceutical research centers in the US collaborate with research centers in India in a quick manner, which will reduce the cost of conducting duplicate trials in each country?
Yeah, actually, this is one thing which USA and India need to work together. And actually, there is a lot of wastage of money on both parts. And we are preparing and we are working on research and development, some sort of a policy framework we want to bring in, which will cover basically this aspect also, having partnership with the, important countries like USA, where we can reduce the cost of, research by avoiding the duplication. That is one thing. Secondly, we also would like to work in the field of industry academia linkages, and USA is a leader when it comes to, and so naturally, there are other things also on which we are working. We would like, USA universities to come to India and establish their campus, and would like also the visiting faculty from USA. So I do agree that research we need to work together to avoid and reduce duplications.
Thank you, Dr. Vaghela. Our next questions are for the state governments. This is for Principal Secretary Das, Chief Secretary Valavan, and also for Chief Secretary Ram Subodh Singh. Each of you talked about some of the incentives and services that you are offering to U.S. companies, particularly small to medium business enterprises. Please highlight the specific services you are able to provide companies, and also talk a little bit about your most recent success story, which company was able to successfully invest in your state. Mr. Das, let's start with the Gujarat.
Thank you. I'm the Managing Director, Industrial Extension Bureau. Your question is well taken. I would like to brief about the policy incentives which is being offered by Government of Gujarat to the industries, including larger industries and SMEs. I would like to underline that recently we have come up with a new policy day before yesterday only, and this policy offers very good incentives and handsome package to the industries in view of this challenging time, the post-COVID time. This is a very encouraging economic revival step that Government of Gujarat has taken up. The new policy has simplified the tax calculations, simplified the incentive calculations, and specified the third sectors and the sunrise sectors under the policy schemes. The healthcare and the pharmaceutical is the core sector as per the new policy of Government of Gujarat. We offer 10% of fixed capital subsidy to the general sector and 12% of the fixed capital investment subsidy to the third sector, which include pharmaceutical and healthcare. Exemption from electricity duty has also been given for 5 years. Government of Gujarat has taken due cognizance on the research and development sector, and first time the provision for offering the incentives for R&D sector has been incorporated in the policy. And government, the policy provides the support up to 50 million to private companies, institutions for setting up R&D and product development centers in Gujarat. So it's a comprehensive strategy Government of Gujarat has taken up to boost the investment and to boost the business in Gujarat. If we talk about MSMEs, the SMEs, we are eligible for the capital subsidy up to 25% of their loan amount, interest subsidy up to 7% of their term loan, and provided support up to 65% of cost of acquiring foreign patented technology if it is required. Apart from that, government has given the ease and recognizing the capital need of MSMEs, and to reduce the operational cost of MSMEs have allowed MSMEs to have the captive use of renewable energy of 100%. That is a great boost to the renewable energy promotion activities and the MSMEs in Gujarat. If we talk about the EODB, ease of doing business in Gujarat regarding the SMEs, Government of Gujarat has come up with an MSME Act which exempt the MSMEs for taking any approval for 3 years. The MSME can immediately set up their unit if they want to set up within it's a matter of minutes or hours. And government has matched up with the revised definition of Government of India, which specify the revised definition that includes the plant machinery investment up to 50 crore and 250 crore turnover annually. So these are the, apart from that, Government of Gujarat has come up with a new provision for land lease policy. That is which is something very different, that Government of Gujarat has taken the lead in that. Government will be offering the government land to the industries. They need not to invest. They did not make the huge capital investment in purchasing the land. Government would be offering government land on the rate of 6% of the market rate. So the committee will decide the rate, and on the 6% of the market rate, the government land would be given on lease basis for 50 years. So this is the big boost and the bigger relief to the industries, where they can use this capital as an operational and the capital of working capital for their business in Gujarat. So this and one more thing which is very important highlights of the new policy, that government has offered the relocation incentive also. If some companies are relocating from any other country to Gujarat, government would be considering the incentive, special incentive to the companies who are relocating in Gujarat. So that will be taken up the case-to-case basis. But this is again, government has taken the note of this very important aspect of and the concern of the companies.
Thank you.
And the rest, we will be sharing the policy paper with the CGI Houston. We have already shared with, and we will request sir to please provide the copy of this policy document to all the participants who are present here in the webinar. Thank you very much.
Thank you. Mr. Valavan, would you share the same about the opportunities with the state of Andhra Pradesh?
Yeah, thank you. In fact, we have already communicated the policy document with the Houston Consul General. We are providing incentives in the form of investment subsidy, SGST reimbursement, power cost reimbursement, and interest subsidy. We call it Pavla Vadi. That is only 3% they are supposed to pay. The stamp duty reimbursement, rebate in land cost, land conversion charges are also being reimbursed. So this is being provided. Apart from that, for the mega projects, which are linked to the employment, suppose whichever industry provides more than 2,000 and more employment, so they are categorized as mega industry, and they'll be provided tailor-made incentives. So that is different. That for electronic industries, different type of incentives. For bulk drug industries, different type of incentives. All these things are there. But major attraction here is the land bank. The land bank, the coastal, the infrastructure. So we have the skilled manpower. So these are all the major attractions, because we are developing the coastal shipping also, so that the logistics cost can come down. So our intention is to support the industry so that the initial investment cost also will be less and the operation cost also will be less, so that the industry can become competitive in the market. So that is the intention. Apart from that, and we have the end-to-end. I just discussed in my speech that the end-to-end business enablement center. So that will provide hand-holding support to the industries, right from conceptual level up to commissioning of commercial production, and also even beyond that, the market support, sales support, and everything. So these are the in the recent past, we have got many big industries in electronics, in other manufacturing sector like ATC tires from Japan, Toray from Japan, and Walsin from Taiwan, and Wintech from Taiwan, Dixon Technologies. So we have, these are the companies which have expressed their interest, and they are establishing. We have provided the land and they are grounding the units. Thank you.
Thank you, Mr. Valavan. And if Secretary Ram Subhag Singh can also provide some additional information on some recent success stories of investments into Himachal Pradesh, that would be wonderful.
Thank you. You can call me Ram for it will be easy for you. Okay, so your question had two parts, and I will address the second part first because that has not been answered so far. Himachal, we organized an investors conference, investors conclave in the month of November last year. And the 700 companies signed MOUs with Himachal government for $14 billion. And you will be happy to note that within 45 days of signing of these MOUs worth $14 billion, $2 billion MOUs were actually grounded. People started work within 45 days. So this is the kind of speed with which we worked on our MOUs. And it is just because of COVID that we have now had to postpone our second groundbreaking. Otherwise, believe me, I still have about $2 billion worth MOUs ready to come and to be grounded. So this is the investment success that you were asking in the second part of your question. So I hope that this will provide necessary motivation to our friends in US to look at Himachal. The second part, the first part of your question on the investment facilitation and the kind of incentives that we have. Most of the other two states have talked of the similar things. First of all, we have acquired land. So there is no need for people investing in bulk drugs or medical devices to go around and negotiating the land with, the landowners. It is the industry department which has a dedicated pool of 3,000 acres of land with us, which will be allotted on very concessional price. Now, what concessional price will it be will depend on the kind of investment that comes. If it is in a cluster, suppose I get 10 or 20 companies in bulk drugs, I may look at providing the land at absolutely, low prices. There is no problem in that. Second, I told you about power. Himachal is a power surplus state. So I have enough flexibility to, to give power to the industry on a rate which is very attractive. In fact, my rates in Himachal are one of the lowest in the country as far as power is concerned, and most of my power is hydropower. So it's a clean and green power. And on the stamp duties and the other formalities, all that is similar as what Andhra and Gujarat has said. Plus, I want to tell you two more important things. One is that for MSME, which means 250 crores, that is in millions, would be about 35 million. So every investment which is less than or up to 35 million, there is no need of getting any clearances beforehand. You start your work, we'll give you clearance in 7 days, and then you get it, you get your certificates from different departments in due course of time. And the last but not the least is that every investment coming in bulk drugs or medical devices, which is over $50 million, will be provided a dedicated officer to take that investor all the permissions that are required from the government. So these are the things that I want to highlight from Himachal Pradesh.
Thank you so much, Ram. All of our speakers thus far have talked about the importance of making entree into India. They've talked about the wonderful incentive packages that are available to companies that are interested in investing. I would love to hear a few thoughts from Mr. Bagla with Invest India on how companies who are interested in taking advantage of these opportunities can work with your team specifically to get their registrations done and to get their investments facilitated at the central level into the specific states. Mr. Bagla?
Thank you, Neil. It was really, did you hear each of our state governments speaking? See the kind of incentives and the competitiveness which is being created in India today. The big change, and I told you we are at an inflection point. The interesting thing where India is today is that good economics has now become the center of good politics. And the result of that is the focus is not just on viability. The focus has moved on to profitability. So when you talk about these incentives, did you hear each of our senior civil government officials telling you either be it land or be it fiscal benefits or other forms of incentive or the ease of doing business? I think the same thing you heard right through. A person to handhold you, a person to help you with the entire set of approvals, to get you land which is cheaper. What Invest India does, it's actually the only platform in the country where all the state governments and the central government together are stakeholders. So we, for every investment, and a number of them, we have our partners today on the webinar, you get a dedicated relationship manager. The manager shows you everything from the opportunity in India to work with you, to tell you what are the approvals required, to help you identify a location, a state, the appropriate one, to get you all the approvals at the state level and the central government level. And it's not just there to get your commercial production started. It is also at a point where even after the business has been there, to handhold that entire business right through its journey in India. I'll give you an example. When the world's largest wind power company was wanting to set up a blade manufacturing plant in India, and mind you, they have plants in I think about 18 or 19 other countries. One of the things my team asked them is that where have you had the best experience so far? So they named a neighboring country where they said they could get it from the day their board gave them approval in their head office to the day the first blade came out manufactured of their plant was in 18 months odd. You know what was their experience in India? Invest India facilitated them, and we've got one of the state governments with us where the plant was put. 14 months, 23 days from the day they got approval. So what is the focus is on ease of doing business. And the other focus is how we are shortening the entire cycle of the utilization of capital. And that is where the capital is not being lying idle. As a result, it's a kicker on the returns which come out. That is what India is. There is where Invest India comes in, and that is where my state governments come in, my central government comes in. You will have just one person who will be dedicated to you. If you want for an investment over $1 billion, I'll give you that person anywhere in the world, wherever your office is, until you start commercial production. That's my promise. But thank you, Neil. This is a new India, and that is what I keep emphasizing. Don't miss the opportunity.
Thank you, Mr. Bagla. I can certainly speak from personal experience that working with your team, and it really makes it easy to facilitate investments into India. So thank you so much for that. Your team is doing an awesome job. Similarly, there are many Indian companies that are looking to invest in Texas. We have one of the largest economies in the world. If you rank Texas along with countries, we come in the top 25 countries in the world in terms of our sheer economics and size. And so it's no surprise that we have nearly $10 billion of investment from India into Texas. We have our friends from the Greater Houston Partnership with us today. I think Jensen Shen is with us. Jensen, can you quickly talk about how an Indian company that may be interested in investing in our great state, what resources does the Greater Houston Partnership offer for those companies? Just a really short introduction of the services.
Yeah, I'm Jensen Shen. Today, we with me is we have another FDI manager, Gabby Aslakson, with me. Similar as Neil, she is on behalf of Dallas, and we are on behalf on the Houston. Both Dallas and Houston are great cities. So we are all in the state of Texas. What we can do is we'll provide, when you have an interest, when you tell us, we are like, if you are interested in the Houston, you need to talk to us, then we'll help you to find a potential partner and site, and we'll give you a database information. So how much is the labor cost? How many is the working force? And how much is the incentives you may get? All the incentives is based on your capital investment and your future employee number in the Houston of Texas. So besides this one, and when we send you a database, and you will look at which partner you are targeted for. If you can get the link, if you get connected with them, you will further communication. If you don't have any reply when you send the request, you will let us know. Don't forget, we are on in Houston. You talk to us. When you want to go to Dallas, you talk to Neil. Okay, thank you.
Thank you, Jensen. We really appreciate the great work the Greater Houston Partnership has done to help facilitate investments into the Houston area. And we are certainly here to help facilitate investments into the DFW area, and we have certainly done so in the past. So thank you for both your work and also our partnership as well. At this time, I want to turn a few questions to our corporate entities that are investing in India or investing in the US. I'm going to start with our three corporations that have invested in India: Pfizer, Phoenix, and Baxter. Starting with you, Mr. Subramanian, talk to us a little bit about what was the thought process when Pfizer was thinking about investing in India? What went into the decision-making process? What were the concerns? What were the questions? Talk to us a little bit about that decision-making process and why Pfizer said yes to India.
Neil, thank you for the question. We are frankly a very old company in India. We were set up in 1950, a 70-year-old company with a huge legacy of global brands in India. Over the years, what we have really done is we have brought the innovative technologies of US into India for the Indian patients. And as a result, in the last 70 years of business, we have a very good balance of off-patent and innovative portfolio today. We have a 50-50% of it. And the last 2 years especially, we have fast-tracked innovative launches in the country, given a very strong, favorable environment in the country. We have launched about 10 innovative in the last 2 years. And that also at very special India pricing for access for India patients. Very different from the global thing, because we want to make, and every single brand launch will have a very special access to Indian patients. Also, we are working very closely with various state governments in the area of preventive health, in terms of vaccination, oncology access, etc. So for us, we are happy to be present in the country today with access and availability. And especially in the last few months, we have seen a significant amount of help from DOP Secretary, Mr. Vaghela, during the COVID times, where he's been amazingly fantastic in helping all business issues resolved. I worked as OPPM member and also FICCI member, had a very close working. And also we had a very close working relationship with Mr. Deepak Bagla as Invest India. We are happy to work on a lot of vaccination incentives, part of preventive healthcare for the country. So we have been very happy working in India. We have seen significant changes in policy measures from Indian government, and that keeps us going. Thank you.
Thank you, Mr. Subramanian. Mr. Mehta, why India for Phoenix?
Neil, in 2011, we looked at many different countries in Asia where we wanted to move our manufacturing out of China. In China, cost creep had started already around that time, but India was still not on the map at that time compared to many other countries. But we could see, we were a little more forward thinking in that we could see the potential that India could offer in the next several years. And we primarily came in on that potential in 2011. And on hindsight, our decision was correct, because today we are able to serve not just the India market, but our US MedSurg customers, retail customers have seen diversification away from China, and they have seen India as a very viable manufacturer in our area of wipes, diabetic disposables, and other such products. So given our road in India for the past 8+ years, I think today we feel very confident that we have made the right decision to be in India, and we would like to expand and diversify and further strengthen our manufacturing base in India as we go along.
Mr. Mehta, as a follow-up question to you, steps would you recommend either the US or the Indian government take to increase trade and to strengthen supply chain partnerships in particular? You know, it's not just about manufacturing, but it's about distributing those products and services both within India, but also out of India, exporting them. So talk to us a little bit about what steps you think can be done to strengthen those supply chain partnerships.
I think supply chain definitely needs to be improved in India, and I think everybody recognizes that. And I think the government in the last few months have made a lot of new initiatives in that regard. Now, I can tell you regarding our products, we are still not able to source 100% of our raw materials in India. And that is something of an irritant for us. And I think your manufacturing presence is complete when you can source most of all your raw materials in the country where you're manufacturing the products. But like I said, Neil, over the past several years, compared to where we were in 2012 to where we are in 2020, there has been a significant improvement in the supply chain as well. And we see several companies coming up in India to support companies like us with raw materials and other such items.
Thank you, Mr. Mehta. Appreciate your thoughts on that. Mr. Dang, the same question to you. What specific opportunities do you see for strengthening the supply chain partnerships in India, both for internal distribution and also export back to the US or to other parts of the world? What has Torrent's experience been, and how would you like to see that enhanced?
I'm from Baxter, so Torrent is coming after me. I'm sure that he will take the question.
Oh, I'm sorry, Baxter. I'm so sorry.
Yes, yeah. But you know, from an India point of view, couple of straightforward things. One is, of course, if you look at India opportunity, one is the opportunity in India and opportunity from India. And if you look at the opportunity in India, I think clearly a lot of speakers have talked about it. It's an underserved market, 1.5% of GDP right now in healthcare, going to 2.5%. The healthcare is expanding rapidly in terms of schemes like Ayushman Bharat, Prime Minister National Dialysis Program. A lot of states are focusing on healthcare increasingly, and so to me, from you know, when you look at the opportunity in India, the healthcare opportunity is fairly large as we go ahead. Also, India creates an opportunity from India to other places. We have a very large plant in Ahmedabad, which supplies to more than 63 countries in the world generic injectables. We have R&D facilities which support global operations. Similarly, IT facilities which support global operations. So these create opportunities in the country because a country is rich in resources, particularly talent. So, and then that is supported very strongly by a very, I would say, flexible and an agile policy environment. So, for example, I could reach out to Mr. Deepak Bagla if I had a certain issue related to investment in India very quickly, and I will be very confident of a response. So I might not have met him, but I could reach out to his office. Similarly, Secretary Vaghela or Mr. M.K. Das, or for example, I was in conversation with the Chief Minister of Himachal Pradesh the other day, and we were discussing home healthcare policies. And Mr. Ram Suhag Singh is here, but we discussed that. So I think the policymakers are very accessible. You can reach out to them. They will give you a quick response, and they mean business. So this creates the right ecosystem for a company to operate, and that's what's been my personal experience of working with Baxter, and we've been doing it for the last 8 to 10 years. I've been around.
Yeah, I would agree with you that I think Baxter's experience is very similar to many companies that have been looking to invest in India, where the governments have been very accessible, and that has certainly eased the ability to invest and really made it easy for companies to do so. Thanks for sharing your thoughts. At this time, I want to turn to Mr. Jaswinder Matharu with Cadila and talk about what your experience has been investing in the US specifically. And a similar question to you, what would you like to see done in the US to strengthen the supply chains here to ensure they are functioning optimally? And what else can the US do to enhance those partnerships that enable you to be successful? Mr. Mathar.
Sure. So, doing business in US is not terribly complicated. The infrastructure that the US has, because of all the industrialization, actually, it makes it fairly easy to do business in the US if you have the investment capital to come and invest in various activities that you want to get engaged in. So that's, from a regulatory point of view, as you know, it's fairly easy to set up companies, transfer capital, invest capital, very little regulation in the states that you work with. And they are actually very helpful in setting up different, I guess, infrastructure projects for you. Okay, so from that point of view, I don't think, you can always do better, but, and better is just give you free money, which literally the government is giving if you are trying to de-risk the supply chains and things like that. The biggest challenge in the US is actually, the way the distribution model works for pharmaceuticals, which, is fairly complicated in the sense that due to, again, regulation and the way Medicare and Medicaid works and the way the billing systems work in the US, there are many, many layers of, business models from manufacturers in India and here in the US all the way to the consumer. And you have 4 or 5 very large companies like McKesson, like Cardinal, like Walgreens and people like that, who literally control the supply chain of pharmaceutical distribution in the US. And as you know, that with the current executive order by President Trump, he's trying to kind of make that a little bit more simplistic. So I think that would be one of the bigger challenges. And the US is a very, very competitive marketplace. So what it means is that practically any player who's in the pharmaceutical industry is playing in the United States, which makes it, like I said, very, very competitive. And I think a lot of the distributors like McKesson, Cardinals, and ABCs of the world, they use that competitiveness to their advantage and to the detriment of manufacturers in India. What I mean is that they play price one against the other, which anybody would do in a good business environment. But I think some of the practices that they get engaged in may not be as beneficial to either them or to the population of the US. And that's kind of where the executive order came. So that's part of the question one that you asked. What was the other thing you wanted to kind of get some insight on?
Yeah, what are the supply chain enhancements that you would like to see that can facilitate your expansion or ease of doing business in the US?
Yeah, so from an expansion point of view, pretty much most of the Indian companies who are at scale already have manufacturing capability in the US or are building manufacturing capability in the US. And the manufacturing capability there are 2 really good reasons to do that. One, somebody else already mentioned, I think Sanjay, you mentioned this, that if you are building a narco-based product, then that cannot be exported from India. So you do need to have, local facilities for any controlled substance distribution. What we've also seen is that as you get more complicated in your formulation, like an injectable or even a gel or something to that effect, which is not an oral solid, then having a local supply chain is actually quite beneficial. And I do believe that the FDA is also now starting to put some pressure on local manufacturing to de-risk a lot of the supply chain. And I think the biggest challenge here right now is that the API dependency on a specific region of the world is actually risking everybody. And now there are many opportunities in the US. Unfortunately, the Kodak deal ran into some headwinds because of some SEC investigation. But that was a good attempt by the US government to try and bring a lot of the KSM manufacturing and API manufacturing to the US, which, as all of you know, everybody is dependent upon a single region in the world, and everybody's supply chain got disrupted because after the COVID hit everybody. So that's the investment in the US in building actual facilities is perhaps one of the clean ways of de-risking the supply chain.
Thank you, Mr. Matharu. And Sanjay, Dr. Gupta with Torrent, the same question to you. As you know, given that we're in a current pandemic, as Mr. Matharu just mentioned, what do you recommend the U.S. take to help increase trade or to strengthen supply chain partnerships in facilitating investments like the one that Torrent made? What has the experience of Torrent been, and why has it been effective?
So we've had a very positive experience in the US. It's been a long number of years, and we made mistakes, as I said. So I would echo what Mr. Matharu said. In terms of difficulties in dealing with a very concentrated market, so the US regulates monopolies in terms of suppliers, but not in terms of purchasers. So what we have ended up with is 3 or 4 purchasers that control about 90% of the purchases in the US market. And that is actually detrimental to the long-term safety of the supply chain, because these purchasers tend to be price conscious to the detriment of security of supply. So that's something that should be addressed. And I think we began to address that. And in the COVID times, when supply chain security is a must, and people are paying a lot of attention to this topic. So this, I think, there's no silver bullet, but a diversified supply chain with a multifaceted approach would be our recommendation. So domestic manufacturing does play a role. The recent executive orders seem to make sense. We are giving up to 25% price preference to domestically manufactured products in the US. In fact, Indian pharma companies are at the forefront because we've set up manufacturing facilities across 15 states in the US with over $4.5 billion invested. The second recommendation would be to create some kind of preferred status for dependable long-term partners. So India has proven, in our case, to be a reliable supplier of safe, effective medicines. We currently supply 1 out of 4 pills the generic drugs in the US. And we secure about 40% of the new product approvals from the US FDA. So this clearly shows that Indian industry is investing for the long term, and we can be counted as a long-term dependable supplier. So I would argue for some kind of preferred status for Indian manufacturers. That would be my recommendations, Neil.
Thank you so much, Dr. Gupta. Those are great recommendations. At this time, I want to thank our panelists and our speakers for joining us for this quick conversation. We're going to continue the conversation in the informal session that's going to follow the formal closing of our first part of our program. At this time, I'd like to thank Jagdeep Ji for his excellent facilitation of this program, and also thank the Consul General and the Embassy of India for their efforts and initiative to put this program together. And at this time, I want to invite Consul General Mahajan to close out the formal session before we head into the informal session. Consul General.
Thank you. Thank you, Neil, for moderating this session. I wish to thank all of you and all our partners, all the people who joined. It has been a long, very productive session. I can understand that in India it is already now late at night with it's almost past 10. But as I mentioned at the outset, we are launching this dialogue as part of a series I have already mentioned to you. And just to lay the template before all of you, with the embassy, we are partnering to continue this dialogue on India-US partnership in healthcare and medical research. The potential has already been highlighted by the many speakers. We are really thankful to Secretary, Department of Pharmaceuticals for this presentation. I should also mention that this investment will, of time and effort which we have put in together as all joint partners, will help us a great deal, because we are going to put out this recording. We are going to put all this out to US companies, to investors in India, and to everyone who wants to connect. The consulate and the embassy, we want to act as bridges for you with US companies. And so, as mentioned by Jagdeep, which is the chamber in Houston, and they work in close partnership with the Greater Houston Partnership. Neil's chamber in Dallas works in close partnership. We cover the entire southern United States. There are many other states with very large corporations, companies, Colorado, Kansas, Arkansas, and Louisiana and other states. And besides, the embassy will partner with us for a pan-US reach on all these areas. In our subsequent efforts, we will focus on the verticals. We will go down on the various verticals, which I've already mentioned. We will focus on collaboration in medical research between medical institutions in India, building institutional linkages, hospital management systems. Houston has one of the largest medical complexes in the world, and there is a great potential for strengthening the hospital management systems. There are already many strong partnerships between institutions here in India on manufacturing of medical devices, drugs and formulations with companies in United States, as highlighted in the Invest India presentation and in the presentations of the various states. There is tremendous potential in this. And finally, in the area of robotics, automation and digital health, we will look for your continued support for these initiatives to connect companies between India and United States and use this time. As Mr. Bagla pointed out, the opportunity is now. We are at an inflection point and we can sense this here. In fact, the embassy and consulate, we have received many live queries from companies. Even today in this conversation, you see in the question answers, and you have seen companies who are willing to invest. So we will reach out with all the resource material which we have today, including the presentations and including the question answer session, which has been very productive, to all people here in United States and in India, and follow through on this with each one of you. We will individually direct the questions to you, the queries to you, and continue this effort on the verticals which I mentioned we are going to build. I once again thank Invest India, USIBC, the Greater Houston Partnership, the Indo-American Chamber of Commerce of Greater Houston, the US-India Chamber of Commerce, Dallas-Fort Worth, the Confederation of Indian Industries, FICCI, the Indo-American Chamber of Commerce, Invest India, the states, companies including Baxter, Cadila, Pfizer, Phoenix, and Torrent who joined. We had many other companies also wanting to join on this continued dialogue, and we will be in close touch with you for suggestions on how we can take this forward. And especially to our secretary, Dr. Waghela sir, thank you very much for this very informative presentation. The productivity linked incentive scheme which you have presented today, we will be sharing this with you. I will now pass it on to Neil, but before I pass it on to Neil, I have just seen that we have received a couple of queries, sir, and if I may, with your permission, I put this question before you about, companies have a question that US companies are wanting to know that if they want to benefit from the productivity linked incentive scheme, do they need to partner or form joint ventures with Indian companies, or they can come with 100% FDI? And secondly, if they make India as the base for exporting to other countries, can they still benefit from this scheme? This was a specific question. And we have from Greater Houston Partnership, our friends and others. Later, Neil, you can take it on and pose this to them. In view of paucity of time, we will continue our extended session. And I really must thank everyone because we are almost touching 3 hours now. But this is a record for posterity for us, and it will be a great valuable resource for us, I assure each one of you. And, thank you again for this time and effort. Over to you, sir.
Yeah, actually, I had replied to this question, and let me tell again that when it comes to investment in India, in medical device, it is 100% automatic route. The company can come and they can invest 100%. There is no need to be partner. When it comes to pharmaceuticals, 100% is allowed in greenfield pharma projects. That means this scheme they can come. There is no problem. Brownfield only. If you want to partner with someone who is existing there, then if you want to invest beyond 74%, then you need to take permission. Otherwise, there is no need of permission. That means medical device, no need of any permission, and pharmaceutical, all new projects, there is no need of any permission. They can directly come and invest. There is no need to become a partner.
And for exports from India to other countries?
Export, there is one issue. As medical devices, we have allowed exports. In API, no, we have said that the company which puts up the manufacturing facility, they may not export. Our idea basically is that we would like to add value addition because India, see, we are the third largest in volume when it comes to export. However, in value, we are 14th. So we would like to say that the API or not API or KSM or intermediate, if they are manufactured in India, after one stage, we want one stage further in India, one stage further process to be done. So KSM is there, then they have to manufacture API. API is then they have to they have to convert into formulations. So that one thing more they have to do, and then that can be allowed. So suppose I am a company, I have put up a plant in API, and then what I can do, the API I may not be able to export, but I can convert that into formulation and I can export. Suppose I manufacture KSM, then I have to convert this KSM into API. API I can export. So our idea basically is not to do value addition in India. That was the idea. We have received the representation, but in API our idea is that we need to add some value addition. But this is not the condition with medical devices. Medical devices we have allowed all kind of exports.
Right. Thank you very much, sir. And as I mentioned, we will focus on the verticals later and amplify this scheme and make it more. We reach out to US companies, so this helps us quite a bit. Yes, sir.
Yeah, I just wanted to add, the question was asked me about this duplication of process. If that details are sent to me, I will see to it, that duplication is removed. And there should not be any problem. A question was raised about research duplication. So we'll be more than happy. And I thank you, Asim. Specifically, I would like to thank you for taking this vertical. That is also an exciting field, and we are working on that. And we would like to work in R&D and all other fields, and education, hospital management, these are very, very important things. We are working on that. And if you can organize another thing, we will more than be happy to be part of that.
Yes, sir.
I should thank all the companies, who have praised us. And during COVID, we saw to it that no company, no factory remained closed. That is what we tried, and we are very happy that, it was appreciated here. Thank you.
Yes. Thank you very much, sir. And as I mentioned on these verticals, we will work under the umbrella of the embassy in partnership with the embassy to connect with companies pan-United States in each of these areas. We have received many registrations and live questions, which we will direct to all the companies. So over to you, Neil.
Thank you, Mr. Consul General, and thank you for those wonderful closing remarks. We've really enjoyed the energy that you have poured into building the trade corridor between Texas and India. It's been really a pleasure these last few months to work with you on these various initiatives. At this time, we'd like to move into our informal session where we will be fielding your questions and directing them to the appropriate panelists to answer them and hopefully help to facilitate your investments into the US or into India, as may be the case. Our first question is for Secretary Rinwah. How do US companies benefit from the PLI scheme? This is actually a question that was just asked by the Consul General, but I would specifically ask, do you have any additional thoughts that should be considered as people are considering taking advantage of this PLI scheme? What thought processes or decision processes have been helpful in helping companies take advantage of this? Is there anything they should consider as a part of their interest in this scheme?
You asked me?
Thank you. Thank you, Neil, for giving me an opportunity to reply to this question. As Secretary Waghela said, that for a US company to take part in this PLI scheme, they need not form a joint venture. They can come directly on their own. And if they want to form a joint venture, they can come and form a joint venture and participate in this scheme. And we have this Pharma Bureau, an organization set up in the Department of Pharmaceuticals, which would be very happy to handhold all investors who want to come and apply in this scheme. And the application procedure is all online. We have shared the links of the website on our department's website under the tab schemes. IFCI, which is a public sector company, is the project management agency. They have set up separate websites, one for the bulk drug scheme, another for the medical device scheme. The companies can go visit the websites, and they're very user friendly, and they can apply online. They can go through the guidelines. If they have any query, Pharma Bureau would be very happy to reply to their queries so that they don't have any doubt before they apply for these schemes. And these are very attractive schemes. As Secretary Sir has mentioned, for fermentation-based products, 20% subsidy is being given per year on the sale price. And similarly, for the chemical synthesis products, it is 10%, which is huge. The companies can recover most of their investment. And with this new thought going on in all the countries to secure their supply chains, US companies can make use of this opportunity of having their separate APIs or KSM in India, so that the risks are shared. I mean, they need not depend on a single country for their APIs or KS. I hope I have answered your question.
Yes, thank you, Joint Secretary Renoir. Our next question is for the Greater Houston Partnership. The question is this: we are initiating a cancer hospital in the Indian city of Chennai. Who is the appropriate authority to be contacted within the partnership to talk about collaborations for the proposed cancer hospital? And I'm assuming these are partnerships between perhaps MD Anderson Cancer Center or some of the other excellent research and clinical institutions in Houston, and then also in other parts of Texas.
I would like to answer this question is, everyone want to come here to partner with MD Anderson, because MD Anderson is the #1 in the cancer in the world. But we already noted the MD Anderson already have a couple partners in India. So in this case, if we like the hospital in Chennai, they can send us their information, either send it to me or Gabby. And also, I want to repeat again, is Jaideep is our best partner. And when after, besides we working with the Indian Consul General, we have been with the Jaideep, visit India a couple of times, recruit a lot of companies. So now we are focused on the health company now. So if you have some, if you send us the information either to us or Jaideep, then we'll work together. We'll find who is beside the MD Anderson, who would like help you to do this alliance. And also we like you have more detail for us. What are you focused on? You focus on the education, you focus on the clinic, or you focus on the research and how we can support you. So we need a little more detail. But anyhow, we encourage you, come here. There are so many Indian doctors, very, very good doctor in Houston, can help you as well.
Thank you, Jens. Our next question is for Mr. Mike Mehta with Phoenix. Mr. Mehta, talk to us a little bit about your thought process when you are selecting a state in India for your new planned investment. What are you specifically looking for, and how? What information, additional information, would you want to have in your decision making?
Neil, thank you for the question. When we were looking to set up the facility in India, most at that time, primarily 95% of our product was going to be exported back to the United States. And our main product at that time required gamma sterilization. So the two major factors for us regarding the state selection were the proximity to the port, which in our case is JNPT in Navi Mumbai, that's close to Navi Mumbai, and access to several gamma facilities close to our facility. So those were the two major factors in selecting Navi Mumbai for setting up our manufacturing facility in 2011.
Thank you so much, Mr. Mehta.
Thank you.
Our next questions are directed to Mr. Ram Subhag Singh with Himachal Pradesh, and also Mr. Karikal Vallavan with the state of Andhra Pradesh. One of our companies, Ansh Labs, which is based here in Texas, is a market leader in endocrine immunoassays for women health diagnostics. 1 out of 5 women suffer from reproductive health disorders, including pregnancy complications. How can this particular company that is looking to make a $10 million investment into India potentially work with your state to provide cost-effective testing in India? Mr. Singh?
This is for providing testing facilities, or what kind of facility do they want to give? I want to just understand it a little better.
Yeah, it's lab-based testing.
Lab-based testing. Okay. So in Himachal, see, what we can do for them is that we can link them with the health department, and we can, but they have to, in case they can send me a proposal a little in detail, so that I can also understand what kind of market will be available for such testing, and whether it will be making some economical scale for them. So I would appreciate in case something can be sent to me so that I can get it analyzed and tell them of the market potential for these kind of tests. Because manufacturing medical devices or bulk drug is a separate ball game altogether. And, setting up labs and testing facilities do require a catchment of market in and around. So I'll be glad to answer it a little more in detail in case they can, give me a more specific query on this.
Sure.
Can I come in? I think Jitendra Sharma is sitting here from AFTZ. He will be more than happy to reply on that. Jitendra, can you reply?
Yeah,
Yes.
thank you very much, sir. Thank you indeed for that opportunity. Actually, immunoassays require biocharacterization facility. Mr. Mike Mehta very rightly pointed out as gamma sterilization needed for many of the biologics that we make and products like dialyzer, diabetic needles, and so on. When we set up AMTZ as the first medical device manufacturing park in the country, we have set up all the facilities that are required for production of such goods, right from gamma sterilization to 3D injection molding, printing, biomaterial characterization, and diagnostic assay validation protocol facilities. So when such a proposal comes to us, what we do first is to ask the proposer what is the size of the clean room that you need, and what is the characterization of the clean room that you need. Do you need a 1,000 class clean room or a 10,000 class clean room? The instrumentation you need. Do you need an RT-PCR based facility or a assay characterization facility? So what we do in AMTZ is that since we have all those facilities already with us in the campus, we allocate a ready facility to the company. Once they start producing, we take them to the regulatory pathway to get them the required regulatory clearances, and then we tie them up with the National Diagnostics Program so that they can be supported with market access. So right from testing, sterilization, validation, regulatory affairs, and market access, we tie them up with the entire value chain. We would be happy to handhold them as we receive their firm proposal.
Thank you so much, Dr. Sharma. I also want to add, you weren't introduced earlier in this program, that you are a healthcare technologist who is leading Asia's first medical equipment manufacturing zone. And you are the founder and managing director and CEO of Andhra Pradesh's MedTech zone near Visakhapatnam, which is on the Andhra coastline. So I want to thank you for sharing those thoughts with us, and also wanted to make sure that our participants and our audience knew the efforts that you were leading in India. So thank you so much for those thoughts.
And I just wanted to add 30 seconds of information. Actually, Mr. Waghela, the Secretary Pharmaceuticals, gave such a wonderful presentation on the PLI scheme. And as the chairperson of the technical committee that drafted that scheme, let me confess that every word of the scheme has gone through Mr. Waghela's personal scrutiny. And as again, the chairperson of the technical committee, which will evaluate this proposal, as a chairperson, I can tell you that Mr. Waghela has given us firm direction that we should not only be evaluators of the scheme and the proposals, we should handhold the companies that come forward to apply. We should mentor them and support them like friends and colleagues in their successful application. So I want to give you my personal commitment as the chairperson of the technical committee that we will leave no stone unturned in supporting any company that applies for PLI scheme, because we have wonderful leadership of Mr. Waghela guiding at every step.
Thank you so much, Dr. Sharma. We'll just take a couple more questions at this point, just in the interest of time. As the Consul General noted, we are running into the 3-hour mark here, so we want to be respectful of everybody's time. I wanted to mention for Ansh Labs and other companies who may be thinking about similar investments to definitely reach out to either Jagdeep Ji or myself or the consulate, who can connect you with Mr. Bagla's team at Invest India, because they are very helpful in helping to direct these investments. And certainly, please reach out to any of our speakers today who have shared thoughts and insights with you, where you may be able to use their resources to facilitate your investments. So we had another question here about the opportunities for utilizing yoga, meditation, and other techniques to reduce healthcare costs for companies. I wanted to ask Mr. Das's office with the government of Gujarat if you can talk to us a little bit about resources or opportunities that may be available through your offices for any US-based companies that are looking to reduce their healthcare premiums by improving employee wellness. If there are any opportunities there, we would love to hear your thoughts on that. And also, if there are any additional thoughts you would like to add on facilitating investments into Gujarat, we would like to hear that.
Let me first make it clear that the healthcare is a part of the service sector. And if we are talking about the investment in the testing lab, pathological labs, so we are coming up with a new policy of service sector. And if some company want to invest in Gujarat, so they can contact Index TB. We will be liaising with all the other departments and taking the concerned and multiple stakeholders on board. I understand. And we have single window clearance system also in place, so they can apply online, and all the approvals are accorded online within the given timeline under the RCPS Act. I understand, Ms. Neil, I have replied your application.
Thank you so much. Yes, there was one other question, maybe more of a healthcare innovation tech opportunity. Are there any healthcare tech companies in Gujarat today that might be able to help US companies reduce their employee healthcare costs through their efforts, through the particular services or products they may be offering with yoga and meditation as those?
Can I reply?
Yes, please.
Okay, see, I don't know, but I am, I am connected with Art of Living, and it is an organization which does offer, excellent healthcare, courses in yoga and stress management, and also, in handling the tensions and the general, uneasiness while working with unpredictable and critical situations. So if anybody is interested, I can put them into that. I have got my selfish interest because I am connected with that organization, and I'm connected with one of the meditation center, very big meditation center in Gujarat. So if they are interested, they have got the centers in USA also. So they did not travel all the way to India, but in USA also they have got the centers and some of the meditation centers. So if they can come back to me, I'll be more than happy to work.
Us and improving their employee health. We really appreciate that.
Neil, can I join? Ram from Himachal.
Yes, please, yes.
Okay. So, I was a little hesitant giving you the kind of advice that our Secretary Pharmaceutical has given. But let me tell you that I am also a follower of Art of Living, and I have also joined courses of Isha Foundation and couple of other. So there are lots of organizations working in India who are really working to reduce your stress levels, to take care of your anxieties. And I'm sure that a direct benefit of that is going to reduce in the insurance cost for the health needs of American companies that have come to you with this question. So I think one of the better way of going about it, if this is a matter of concern in your opinion, is that I will request the Council General Asim to have a separate session with such foundations and organizations who are into this. And I can tell you from my personal experience that yes, they do benefit, and yes, it reduces your medical cost and your health needs. Thank you.
Sir, Neil, just a quick one on this. I should tell you that this part of United States has great zeal and enthusiasm in yoga, Ayurveda, and those areas. In fact, in the recent International Day of Yoga, we actually every year have more than 200 events. And MD Anderson Cancer Institute, which is one of the largest cancer institutes in the world, their director also gave a message. They have yoga and meditation as part of the treatment.
Wonderful. Thank you so much, Consul General. And we have one last question before we close out the program, before I hand it back to you. And this one is for Mr. Subramanian with the government of Andhra Pradesh. For facilitating investments into Andhra Pradesh, do companies need to go through multiple specialized agencies dealing with the sector, or is there a single window clearance for companies that are looking to invest in AP? Mr. Subramaniam?
Subramaniam here. I'm the CEO of the AP Economic Development Board, and you have asked the right question to the right person. The Andhra Pradesh Economic Development Board Act legally specifies that all investors go through a single channel, and that is the Economic Development Board. And we have got relationship managers who would handhold the investors, and we have a very efficient single desk portal in which investors will go through a common application form, and 22 departments, all applications, whatever the approvals are required from 22 odd departments, go through a single desk. And in case they are not given with the legally within under the Public Service Guarantee Act, 21 days is the time given. And in case any department fails, they are deemed approvals, and there is a single desk bureau which gives this deemed approvals. And our secretary was mentioning a little while ago that our compliance to the single desk portal is 99.3%, and we would strive to be 100% there. So we are a single face for investors, and anyone wanting can please reach out. Thank you.
Thank you so much, Mr. Subramaniam. At this time, we will conclude our informal session. We hope you have found this program valuable. On behalf of the U.S.-India Chamber of Commerce in Dallas, the Indo-American Chamber of Commerce of Greater Houston and Jagdeep, as well as the Greater Houston Partnership and the Dallas Regional Chamber of Commerce, we want to thank you for your interest in Texas and for your interest in investing in India. We hope to help you facilitate bilateral investments. And with that, I would like to thank all of you for your participation and let you know that all of us are here to be a resource for you. I am also entering my contact information into the chat box here. So for any of you who would like to contact me with the US-India Chamber of Commerce in Dallas, you're welcome to reach me at this particular email address. With that, I would like to hand this back over to our Honorable Consul General, Aseem Mahajan. Thank you so much for your leadership in the area of trade. And this has been a wonderful program to both listen to and participate in. So thank you for your initiative in this particular area. Consul General.
Thank you, Neil. I think we are really now almost 3 hours into the program, but as I mentioned, we are going to put out a recording where we will also give contacts of all the states, Invest India, the various stakeholders, and from Greater Houston Partnership, I can see Mr. Jensen. We will work closely with you with the great resources available here. It was mentioned earlier that Texas alone has an economy of $1.8 trillion. You know, if it would rank amongst the countries, it would be the 10th largest economy. So there is a great potential, not only in one state, but across United States. And we will put all this together. Your contact details will be duly put everywhere. These presentations will be properly disseminated, and these will be available as resources to us. And this dialogue we will continue, sir, as our Honorable Secretary has guided us, and we will also build on those verticals and stay in close touch with you. So please stay safe.